Hello, 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 my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, January 17th, and it is time for another support group meeting. Let's see here. I'm going to get all my settings all correct. I didn't know when I started a support group I'd have to be a tech geek, but I have to be a tech geek too. Hello, YouTube. How you guys? How you doing? Hello, Facebook. Let's see here. So the purpose of my doing these meetings is to make you so strong, so knowledgeable, so informed that no one can ever mess with you again. I want you to be able to walk into your doctor's office being a strong, powerful advocate for your healthcare. You are the boss. They are not the boss. You are the boss. You pay them. They don't pay you. And sometimes with IC, what happens is we give our power away, and or we get so desperate, or we let anxiety control us so much that we're okay. No sound. Kathy has no sound. Christina, do you guys have sound on Facebook? How about YouTube? Can you guys hear me on YouTube? How is this? I mean, I think the sound is okay on YouTube. Hi, Brooke. Hi, Caroline. Facebook, you tell me, how is the sound? Testing 1, 2, 3. Testing. Can y'all hear me on Facebook? Yes. Okay. Elizabeth hears me. Christina can hear me. Ella can hear me. All righty. So Kathy, check your sound setting. Maybe you got your volume turned off because we've all done that before. It's just so embarrassing when you realize in hindsight that, yeah, you just turned it off. I've done that many, many times myself. All right. My purpose in doing these meetings again is to just give you good, solid information. And it's very important that you understand that you have to be able to talk about your symptoms, talk about your treatments. I do not want you to walk into your doctor's office and say, I don't care what you do, just for God's sake, make it go away. Okay, because understand the challenge that we have with interstitial cystitis is that there's a dicey history here. And in years past, they used to strip the bladder wall off completely. They would use medications like chlorpactin and silver nitrate to basically strip off the entire bladder with the hope that a whole new bladder would grow. Of course, the problem with that is that we now understand that IC can be the bladder wall. When the bladder wall's involved, it can be infection, it can be estrogen atrophy, it can be chemical injury. Man, and the last thing we want to do is strip a wound to make it bigger. But there are still doctors out there who are still relying on old therapies. And IC is incredibly dynamic now. The pelvic pain community is incredibly dynamic. We have learned so much in the last 5 to 10 years. Everything you learned 15 years ago, you're going to throw out. Because now we understand that IC is a pelvic pain condition. Now we understand that there are structures outside of the bladder that often trigger bladder symptoms. And now we know why IC patients get IBS and vulvodynia and TMJ and all that sort of stuff. My TMJ is acting up on this side right now. And bringing it forward to 2021, I mean, the reality here is that y'all know that stress exacerbates symptoms. Why? Because when you're under stress, your muscles get tight, and a lot of you already have tight muscles. And when you have tight muscles, that restricts blood flow to the bladder, and boy, that's bad. But the other thing that happens when you're under stress is you're anxious, and when you're in pain, your brain will intensify pain when you struggle with anxiety. And so we're all struggling right now. This has been a very hard year for every single person on this planet. And God forbid you've got a chronic condition like we do. The stress can exacerbate that. And so I want you to know your treatments. I want you to be able to talk about your symptoms. I want you to be able to have a good dialogue with family members and friends who are not treating you correctly or treating you well. And that's why we do these meetings. And let me introduce myself. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I'm the longest serving IC support group leader, I think, at this point in time now in the world. I've been doing meetings since 1993. Holy hell, how did that happen? That's amazing. I bring to you 3 college degrees. I have a degree in chemistry. Yes, I'm a geek. I have a degree in pharmacology, drug development, bigger geek. And then because I love animals and I couldn't tolerate the animal research, I left that and I went into psychology. And I have a master's degree in psychology. And then my website, icnetwork.org, was my doctoral dissertation proposal on how to bring support to people who are homebound. And I'm really happy to say that for the last 20 years, it has been consistently rated the top IC and pelvic pain website out there by Harvard Medical School and the University of London. And ironically, I could not do that doctorate because I was in so much pain, I could not drive. But I'm really happy that project is rated #1 in the world. And I also sat on the US Army IC research panel for 10 years. So I bring to you a really interesting set of skills because I understand the science, but I also understand the psychology, and my specialty is in groups. So there you go. Hey, Brooke has a question. I'm planning on moving overseas, and I'm afraid there won't be support in Europe. Is there an international IC community? Yeah, there is. And if you come on over to our website, Brooke, and go into the support area, you can find some of the other groups over there. There's a support group in the Netherlands. There's a support group in France. There's a support group in Germany. There was a support group in Austria. I don't know if it's still there. There was a support group in Italy. I'm not sure if they are still there. There is a group in Spain. And so there are a number of groups around the world. But remember, on the internet, you can still participate in this group, right? The IC Network works with patients in 92 countries. Hi, Donna. Nice to see you. Hello, Christy, Carolyn, Elizabeth, Christina, Ella, Christy, Andrea. Nice to see you too, Andrea, Elizabeth, Arlene. Okay, Kathy has her sound. Yes, I'm going to take small victories. Hello, Caroline. Hello, Christy. Hello, Ella, Emily, Lisa, Irene, Ashley, Cheryl, Caroline, Andrea. See, if you guys were walking into my physical support group meeting, I'd be giving each and every one of you guys a hug. So there you go. Pamela, estrogen didn't get blood work yet. Progestin was low. Throat swollen, gum swollen, close to a year. Can throat and gums be issues with IC? No, not usually, but it can be an issue with 2 things. We would be looking at Sjogren syndrome. Sjogren syndrome is where you get dry. You can have dry mouth, you can have dry eyes, and a number of other things like that. So I would Google Sjogren syndrome, Sjogren's. And, gum swollen for close to a year, I'd be looking at. Well, let me take this back here. If you're on, okay, this is an important point to make, guys. Some of the medications that are given to IC patients, like amitriptyline, like hydroxyzine, are known for causing very dry mouth. And so it's not unusual for patients taking these medications to struggle with cavities and other dental issues. So, Pamela, that's another thing I would want to know is, are you taking a medication that could be giving you that? Gum swollen, I would also be looking at periodontal disease, hon. And it's hard because a lot of us have not been able to go to the dentist in the last year. I haven't had my teeth cleaned in almost a year, but I have had teeth replaced and teeth pulled. So go figure. Lisa, had my first COVID vaccine yesterday. No impact on my bladder or vagina. Good to hear, girl. Thank you for sharing. There was a little bit of talk on the internet when we were talking about our IC and COVID research. Patients were concerned that maybe getting the vaccine would exacerbate their symptoms. And I don't have any patients who have reported that. None. Zero. None. Hi, Danielle. Hi, Paula. Thank you, Paula. Marcel, I had a urodynamic study, no results yet, but I did my deep breathing and I made it through fine. Thanks for advice. Yeah, baby. Woohoo. We'll take it. Hi, Shannon. Hello, Diana. Diana, it's her new first visit. So you guys, in my support group meetings, when we could do support group meetings, I always let newbies ask the questions first. And so, Diana, please, if you've got any questions, please let me know. DJ says, "Hello, I'm in a flare and I'm fighting a UTI that made it all the way to my kidney. It grew out MRSA. Holy crap, girl! It grew out as multiple resistant Staphylococcus aureus, and I'm in agony. They have me on 3 different antibiotics, and I'm worried about being on so many." Well, girl, listen, MRSA infections, as you know, are rough. And if that's what they've got to do to kill that freaking infection in your kidneys, that's what they've got to do. But what you're going to be doing is rebuilding your biome. So your beneficial bacteria in your urinary tract and in your bowel are going to take a huge hit. That's the challenge with antibiotics. When you take antibiotics, it kills everything, good bacteria and the bad bacteria, and it creates an environment for other infections to happen. And so, DJ, you need to talk to your doctor about those concerns. I would assume that they've got you on some sort of acidophilus. If you can do the yogurt, do some yogurt. I prefer coconut milk yogurt. I do coconut milk raspberry yogurt and blueberry yogurt. Anything with live cultures in it to try to re-inoculate your bladder and your bowel would be important. But dang it, girl, I really hope that they kill it soon, because I have. It's not surprising that it's incredibly painful, and hopefully they gave you some pain medicine, because if there was ever a time where you need pain medicine, is when you've got a MRSA infection in your bladder and in your urinary tract. Holy hell, girl, I am so sorry. Ella says she'd be lost without such group. Oh, I try to be here. Paula said, "Oh, thank you." Laura says, "Do you recommend installations for IC? I'm worried about getting infections from them." Well, okay. So the American Urology Association has a 6-step treatment protocol. And the steps are arranged with respect to the risk of adverse event, right? So they want you to do the easy stuff before you do the hard stuff. So the easy stuff is going to be in step 1, modifying your diet, improving your water intake, trying some supplements, et cetera, et cetera. And if you've given the supplements a good try and they're not working, and you've modified your diet, for God's sake, please modify your diet, no coffee, or green tea or black tea. Then you go to step 2. So what's in step 2? Bladder instills and oral medications and physical therapy. The most popular installation for the last 5 years or so has been a rescue installation. It's a heparin lidocaine installation. It's called a rescue for a reason. It rescues you out of a flare, out of a pain that generally, when you have a rescue, you walk out of the doctor's office symptom free. And isn't that wonderful? But it's only going to last a couple of hours, and then the symptoms will come back. But we really, we're not doing chlorpactin. They're not even mentioned as treatments. We're not doing silver nitrate, not even mentioned in the AUA IC treatment guidelines. There are a lot of different formulas for rescue installations. A lot of doctors like to customize them, but generally the core ingredients are going to be heparin and lidocaine, or if you're sensitive to lidocaine, marcaine. Then they will usually put in maybe a steroid, maybe an antibiotic. It's kind of a free for all. Over on our website, icnetwork.org, I have a list of all of the published formulas. Now, as to the risk of kidney infection, generally we're doing a lot better with infections because we now have single-use catheters. It's not like the old days when they had rubber tube catheters, and after they were done, they put it in a bottle with alcohol and they reused it. They don't do that anymore. Now, what they do is they have single-use catheters, and generally, the type of catheter that's preferred is called a low friction catheter. It is covered with mucus. It's slippery, not mucus. Well, okay, it acts like mucus, but it's covered with kind of a gel, and so it slides in and out very, very easily. Whereas those old rubber ones that were just impossible to get in, they were very, very uncomfortable. And then also you want to go for a smaller size, especially if you've got pelvic floor tension and things seem to be a little bit tight down there. The smaller, the better. So pediatric catheter. Of course, the challenge is the smaller the catheter, the longer the installation. The bigger the catheter, the shorter the installation. So finding that right amount for you is important. For me, I always use the smallest catheter because every part of my body is long and skinny, except for my stomach right now because I ate too many carbs this weekend. Okay. Anybody just like chowing down? Like seriously, like the stress gets so bad that after dinner, you just got to eat something sweet. So I have my resolution is no cookies, cakes, or pastries. Okay, so I haven't had any cookies since New Year. I'm normally really, really good with my resolutions. I've gone a year without um, uh, buying clothes. I mean, I'm really, really good with my resolutions. But the cookies, cakes, and pastries are hard when that's your comfort food. I can have pies. I've got a lot of pies. That's pretty funny. Pauline says, "Have you heard of anything about this study I'm taking part of from Euromune? It's to prevent the top 5 bacterial infections, and do you have any input from it? It's a vaccine taken under the tongue." Yeah, you know what? That's part of speaking of vaccines, it's essentially kind of a vaccination against common UTI pathogens. And no, we don't have any data on yet, but it's fascinating. And thank you for participating and giving the IC community and the urology community the gift of your time and of your body by participating in that study, Pauline. We really appreciate that. Suzanne is in a flare. Suzanne, tell us about the flare. Anne says, if you don't have pelvic pain, do you have IC? Well, hon, IC is a grab bag diagnosis. So I don't even like the term IC anymore. I mean, I think it's too vague. We have to be more specific, and that's why we have subtypes, right? So we've got 5 core fundamental subtypes for IC. Subtype number 1, Hunner's lesions, which we now know are probably viral infections. Subtype number 2, bladder wall injury, because the bladder, like any other part of the body, can be injured. And so generally in this subtype, we're going to be looking at chemical injury. Hello, diet soda drinkers, chemotherapy patients where their symptoms began after chemo, or any sort of chemical trauma, ketamine. That's when we're going to see a real bladder wall trauma or injury, but it's an injury, right? That's an injury to the bladder wall. IC subtype 3 is pelvic floor driven. These are the patients whose symptoms began with a muscle trauma as compared to a bladder trauma. IC subtype 4 is pudendal neuralgia. This is a nerve trauma. And so if you've got sharp pain shooting down your leg, if you have pain when you sit that goes away when you stand, if you've got persistent genital arousal disorder where you're feeling this kind of icky, slightly aroused, but man, it hurts and it's really uncomfortable and awful, and you don't want to tell anybody about it. That's persistent genital arousal disorder. That's because the pudendal nerve has been irritated or inflamed. Then IC subtype 5 is chronic, actually central sensitization, chronic overlapping pain conditions. And that's opens up a whole different world. Because what that means is that our central nervous system has been traumatized in some way, and our brain is stuck in fight or flight. And our goal is to get the brain out of fight or flight. Talked about that extensively in the last couple of meetings. I wasn't planning on talking about that a lot today, but I will if you want. So ultimately, as you ponder therapies, we can't talk about good therapies for you until we understand your body. You are an anatomical mystery to be solved. If your symptoms began after a muscle trauma and it's your muscles that are tight, it would be ridiculous to do bladder installations. If your IC began because you're older and you have estrogen atrophy, then bladder installations that have a coating effect make total sense. So getting back to your question, if you don't have pelvic pain, do you have IC? Some of you, the brain interprets pain in very, very different ways. For some of you, your brain interprets pain as pressure. So generally what we see is frequency, urgency, pressure, and for some patients, pain. If you just have frequency, urgency, and no intense pain, especially pain as your bladder fills, and we might be looking at overactive bladder, though a lot of people think overactive bladder is just early trauma. Hold on. Now there's something happened over here on YouTube. Hold on a sec. Denise says, okay, here's something out of left field. Have you ever heard of urine specimen tampering due to spiteful response over a misunderstanding? Yes, I have actually. Absolutely. Absolutely. Blaze says, how rare are cases where people have HIV with IC? So is there a different treatment to complement the HIV drug? Blaze, awesome. Freaking awesome question. Okay, so understand that HIV is a virus, right? It's an intense viral infection. And in HIV, we see a tremendous inflammatory response. And so um, uh, it's common for HIV patients who are immune compromised to develop Hunner's lesions. That's where, and so the question is why? And the answer is that when you are immune compromised, some viruses turn on. Specifically, the polyoma BK virus is a virus that can turn on. We all have the polyoma BK virus and the polyoma JC virus. They're a natural part of the human virome. And normally they're quiet. But if you become immune compromised, they can turn on. And so we have seen a lot of what we call hemorrhagic cystitis, bleeding cystitis in patients who have HIV. And so, but more so years ago, I mean, HIV is so controlled now. I honestly haven't worked with an HIV patient in several years. Um, So, Blaze, I'd be happy to talk with you offline at some point in time. We can talk about some of the treatment options. I mean, I would really just want to know, number one, do you have lesions? Because if you have lesions, we need to treat the lesion. They need to treat the lesion by cauterization or steroid injection to try to calm that inflammatory response in your bladder. Okay. Brooke says, as I see an autoimmune disease, the answer is no. Generally, it's not an autoimmune disease. Um, when you classify or you try to rank a disease as autoimmune, there's very specific testing that has to be done to prove that it's autoimmune. And IC fails those tests. Why? Because of the subtypes. Remember, if your symptoms began after a muscle injury, you don't have an autoimmune disease, you got a freaking muscle injury. If your symptoms began after chemotherapy, you got a chemical injury. It's not autoimmune for everybody. And it's autoimmune probably for just a very, very small group of patients. Denise says, my poor response to sweets is because of bacterial infection. Do you recommend Macrobid or Bactrim? The doctor also prescribed hun, I can't make any medication recommendations for you, but really the proof is in the antibiotic resistance testing. Normally when they identify an infection, they do antibiotic sensitivity testing. And that will tell you which antibiotic will be the best at killing your specific bacteria. There's so much bacterial resistance out there that we just can't guess anymore. What do I always say? We need facts. No more guessing. We need facts. And that's particularly true when you have a bacterial infection, because they should always do antibiotic sensitivity testing to verify that antibiotics will kill that specific one. There's just way, way, way too much. How about organic stevia? We just don't know enough about artificial sugars to know how they would affect the bladder. Yeah, Blaze, you can just go over to the IC Network, icnetwork.org, and use the contact page. Our phone number is at the top, but call me on Tuesday or Wednesday. Actually, Tuesday afternoon. Tomorrow is my day off, so I usually don't answer the phones on Monday unless it's after 2. Sometimes I do. You feel free to try, but I got to have time off too. Ooh, boy, especially this year. Oh, you guys, you know what? So, believe it or not, we're under another fire warning. It's January. We are expecting high winds tonight, not windy now, and they've told us now that we are on another fire alert. Of course, we're already burned. For those of you who are new, I live in Northern California, and we had a fire sweep right through my neighborhood. All the hills are black, so even if we had a fire, it couldn't get here because there's nothing to burn. All right, Nancy, I do installations 4 times per day. Nancy, I do installations 4 times a day since 1995. You've only had 1 infection. Just need to make sure you keep everything clean. Nancy, wow, girl, you've done 4 daily installations since 1995? Have you ever tried to get off? What happens if you reduce them? Elizabeth says, I was put on potassium citrate for kidney stones. Is this harmful? You won't know until you try, hun. You won't know until you try. See how you do with it. Hello, Jill. It's always nice to meet another Jill. Jill says, my bladder seems to flare with hormones. I'm 48 and skipped my menstrual cycle a few months. It was the best 2 months with my bladder in 3 years. Yeah, hun, it all begins in your 40s. You're in perimenopause right now. And you would think that your ovaries would just gradually shut down, but they don't. What happens is they get super, super random. So you can have triple estrogen one day and no estrogen the next day. And you're going to notice that your periods are going to be more frequent. Instead of every 28 days, sometimes they go to every 21 days. They're going to be shorter. Instead of 5 days, they might be 2 days, and they might be super, super heavy and super, super crampy. And remember too, that the bladder needs estrogen to produce that nice thick coating of mucus that the bladder uses to protect itself. So as you get older, Jill, what's going to happen is you're going to have less mucus, less protection in your bladder. So as your vulva gets dry and your vagina gets dry, so does your urethra and so does your bladder. And that's where foods really matter. You doing something that would have a protective coating effect makes sense. Using some topical estrogen so that your tissue can produce mucus is incredibly important. We call that I hate to say it, girl, I hate to say it. It's called the genitourinary syndrome of menopause. It's like, don't say that word. I'm not that old. It's very shocking. Lorenzo says, I take azo tests when I have UTI symptoms. If there's trace leukocytes and negative for nitrites, I might have rheumatoid arthritis. Is this because of the inflammation? No, it's because your bladder is probably irritated. It can be a couple of different things. So I explained this to somebody on the phone on Friday. So let's take an estrogen atrophy patient for a moment. So let's just say your periods have stopped. Your skin is starting to get drier. Your bladder wall is starting to get drier, right? And so here's a picture of, this is a cross section. Let's see, hold on. This is a cross section of the bladder wall and basically your mucosal barriers. So beneath it all, we've got blood vessels and nerves. We've got 4 to 5 layers of urothelial cells. And then above that, we have a nice thick coating of mucus. We like to call it the mighty mucus. And you can see here, the purpose of this mucus is to keep the irritants in your urine off of the skin, right? But this layer is going to get thinner and thinner as you get older and older if you're not using some sort of estrogen product, right? So what happens is, look at this. Now the irritants in urine are reaching these cells. And this is where it really gets interesting because, the human body is stunningly efficient. These cells can tell that something is wrong. These cells can tell that there's something here that's not supposed to be here. And that triggers a response from your body. So your body is going to immediately send your army, your white blood cells in the area to kill the intruder because it's assuming that the intruder is some sort of infectious agent like a bacteria, right? So all of a sudden, white blood cells come up through the blood vessels to the area that's got a problem. Now, the question though is, how does the bacteria get out of the vein and into the cell where the irritants are, right? I mean, it's fascinating. And it turns out that your capillaries release them. The capillaries open. And as they open, not only do white blood cells get out, but so do red blood cells. And that's why a lot of us have microscopic blood in our urine. It's just a sign that your body is struggling with irritation, something at all like that, right? And so having positive leukocytes is really a sign of a flare. Having positive, a bladder wall flare where your bladder wall's been injured, maybe by food, whatever. But it's the nitrites that are the most important, because if you are positive for nitrites, you have infection. Nitrites are produced by bacteria. So if you have a double positive leukocytes, positive nitrites, then you need to call your doctor and go have a urine test. But if you're negative for nitrites, but you're positive for leukocytes, then that is potentially a sign that you're just dealing with some bladder wall irritation. And you might be able to ride that out for 24 hours, 48 hours, and see how you do. Drink your water, follow your classic flare management protocol. You guys, if you come on over to the IC Network and you sign up for our newsletter, our gift to you is our 40-page flare management guide. And it has hour-by-hour rescue plans on how to rescue yourself out of a bladder wall flare and a pelvic floor flare. And so it will tell you what to do. Obviously, with a bladder wall flare, if you've eaten something that you should not have eaten, the first thing we're going to do is dilute your urine to try to dilute whatever's irritating in it with some water. We might alkalinize your urine with some baking soda, a little tiny bit, quarter teaspoon of baking soda in a glass of water, or some pre-leaf. Pre-leaf is the supplement that has been out the longest in the IC world. It doesn't do anything for your bladder wall. What it does do is it reduces acid levels. So if you're going to go somewhere and you might have to eat or drink something that could be irritating, you take a pre-leaf, calcium glycerophosphate, before you eat it, and this will reduce the level of the acid in it, so it won't be quite so irritating. Okay, so pre-leaf is a fabulous product that's been out for ages, decades. And they are the sponsor of this meeting. And so I would like to say thank you to DSC Healthcare Solutions for believing that IC patients deserve support and helping to make these meetings happen. Jill says, what ways can I work with hormones to feel that good most days? Well, this is where it gets tricky, and this is where you got to work with your OBGYN. It really depends upon the quality and health of your skin. Hormone therapy is very personal. Hormone therapy requires a lot of research on your part, and we have to understand your unique history as well. Oral hormone products are associated with a really significant risk of uterine cancer and breast cancer. In fact, that happened to me 3 years ago. I was taking oral estrogen because my mother had taken it for years. We've never had any hormone-driven cancers in our family. Leave it to me to be the first one, right? And I had used them from the time I was about 51, maybe, and it happened when I was 57. And so it just took 6 years and of oral estrogen every day, and I ended up with early uterine cancer. So you have to weigh the pros and cons of doing any sort of oral hormone replacement. However, topical estrogen is much, much safer. And if you Google topical estrogen safety, you can read all of the research studies. That's what I use. I use a topical estrogen. I don't use an oral estrogen. So you got to do some reading and really try to understand the pros versus the cons, because the risk is real. And man, if it can happen to me with no history in our family, it can happen to anyone. And I loved my estrogen. I had better memory. I felt great. I had a lot of, my skin looked great. I didn't have a lot of wrinkles, stuff like that. And then it happened, and I've been off of estrogen now for 3 years, and I aged like 10 years in a year, going off of the estrogen. And my doctor, I had one doctor say, "Well, go back on the oral estrogen." And I'm like, "Huh? But if I've had uterine cancer, isn't it possible I could get breast cancer?" And he's like, "Oh, don't worry about it. People do it all the time." And I'm like, "No, I'm going to worry about it. I just went through the oral, a year's worth of being terrified of uterine cancer." And then I went to my another OBGYN, my regular OBGYN, and I said, "Is it possible if you've got uterine cancer that you can get breast cancer?" And she said, "Yeah, there's definitely a subgroup that does." And that's why I don't use oral estrogen. I loved it. And I hate what it's doing to my skin. Oh my God. Facials, get lots of facials. Except we haven't been able to do that for a year either. So Ella says, "I've never had an installation, maybe because I was diagnosed in 2009. Well, that's surprising, Ella. I mean, it's viable. It's a viable therapy. They can teach you to do it at home if you have bladder wall driven symptoms. If you got pain as your bladder fills with urine that is relieved by urination, then we're going to be looking at your bladder wall." Dixie says, "As long as I take aloe vera from Desert Harvest and drink only water, I do great. Constipation is hard on my bladder." Yeah. Well, I'm glad that the aloe vera is working for you. That's awesome. Nan says, "I buy low acid coffee from Volcanica Coffee. It's delicious and doesn't bother my bladder." You know what? I have never heard of Volcanica. Let me write that down. We carry a bunch of low acid coffee in the IC Network shop. So the most popular low acid coffee among IC patients is Bella Rosa because it has the lowest levels of acid in the entire industry. So there's Bella Rosa, there's Simpatico, there's Tyler's, and now Volcanica. I got to write that down. Because if it's good, I will carry it in the IC Network shop. I'm happy to do that. And also, too, here, hold on a second. Hold on a second. I want to get something to show you. Hold on. Nope, that's not it. Give me a quick moment. So I did a taste test on our website. I mean, we did a taste about a year ago on a new herbal coffee called Dandy Blend. You see that? Dandy Blend. Herbal coffees are made with roasted chicory, stuff like that. And I gotta say, I am doing this a couple of times a week. It's the best herbal coffee. I can't do any coffee right now because it just messes my heart up. I get arrhythmias even with decaf low acid coffee. And I'm stunned at how much this smells and tastes like coffee. Dandy Blend. You can get it on Amazon. I'm going to try to get this in for our store too. 100% caffeine free, zero acidity, zero bitterness. And I'm telling you, it smells exactly like coffee, but it doesn't flare at all. No irritation at all. All right, hold on a sec. Jane let's go back to YouTube here for a moment. Jane says, "Should we get the COVID vaccine?" Hell yeah. Yeah, absolutely. This is a personal decision, but listen, we did our research study. We are doing the only IC research study. We got about 100 patients now in the study, and the challenge is this COVID can greatly worsen IC symptoms, and it will bring some IC patients who have been in remission for years. It will take them out of remission, and they will be dealing with pain again. So, if not just for your IC, I would be getting the COVID vaccine. But more importantly, listen, COVID is a devastating viral infection. I'm on all the medical groups, and I'm telling you, you guys, Like, seriously, with this new, more contagious variant, I'm gonna be real honest with you. I'm telling you, these doctors are really scared about this new variant. Y'all gotta be wearing your mask and staying at home, and it's gonna be for another 9 months. It's gonna be for another 9 months minimum. But if there's an even remote chance that the vaccine can help control this variant, then yeah, wow, we gotta do it. At least I intend to do it. Subham says, "Can Staphylococcus aureus cause urethritis in men, or is it a normal flora in the urinary tract?" Let's look. I don't remember off the top of my head. So let me do this. Yes, it can. Absolutely, it can. Can also make somebody septic. It's an uncommon cause of UTI, accounting for 0.4 to 4% of positive urine cultures, but it is absolutely possible. Fascinating. All right. Jane wants to know, are bioidentical topical hormones safer? Uh, I just don't have an answer for that. That's what you've got. You got to talk to your doctor about that. Subham says, is it a normal flora of the urinary tract? No, it can be it absolutely can be pathogenic. And so what would be good would be to have a next generation urine test and see what it identifies and see if you've got a drug resistant staphylococcus. It's possible. It's rare, but it's possible. Denise says oral estrogen can cause stroke. Yes, it can. Jessica says, I have leukocytes in my urine, but no nitrites in my urine cultures come back with no bacteria, but I have constant burning near my vaginal opening since I was pregnant in 2019. Well, hun, listen, you had a baby. And there are a number of patients who develop IC symptoms after childbirth. And burning is actually a symptom of tight muscles that are working very hard. And so I would want to know if did you suffer any muscle trauma, muscle injury, muscle tears during childbirth, number one. And number two, if you have pelvic floor dysfunction, have you had a pelvic floor assessment? That would be number one. And number two, I would want to look at the skin down there and let's see if there's any funky hormone stuff going on. Shubham says, the doctor told me it's urethral syndrome because there's no discharge. Is urethral syndrome and IC the same? No, they're not. The challenge, Shubham, is that the male urethra is very long when it's compared to a female urethra. So your urethra is like 5 inches long, and a woman's urethra is like 2 inches long. And yes, those tissues absolutely can become inflamed and irritated. I have an article on our website, The 7 Causes of Urethral Pain. That would be something useful for you to go to. The mucosa of the urethra can be incredibly sensitive to chemicals. So I've worked with men will get urethral pain because of their laundry detergent. I'm not lying. It's possible. And if you read some of the articles on male urethritis, they talk about looking at chemical exposure. Could it be a spermicide that's irritating your urethra? Could it be a soap? Like, for God's sake, don't do Irish Spring or Dial or anything caustic like that. The urethra is sensitive. And when the urethra gets irritated, it's kind of hard to calm it down. And if you're using that same chemical over and over and over again, that could be a bit of a problem. Jessica says, this was my 5th child, girl. So you've had 5 babies. So you've had 5 pelvic floor events. And if I were you, Jessica, the very first thing I would want to do is have a pelvic floor assessment and see if anything's going on with your muscles. Because again, that burning sensation is often attributed to extremely tight muscles that are working hard. A muscle that's working hard produces lactic acid, and that causes a burning sensation. Jessica said, my urologist wants to do a cystoscopy to rule out everything before they formally diagnose. I do feel better when I relax my muscles. Hey, girl, listen, after 5 babies, your muscles have been traumatized. Supam says, I've been suffering from urethral syndrome for the last year. It's so irritating. Urine culture shows nothing. So again, I would be looking at chemicals. And also I would want to know, are you riding a bike, motorcycle, anything that's pushing up from the inside? And also, Supam, can you think of any event? You say, so what do you associate with the onset of your symptoms? Did anything happen? Did anything happen that triggered your symptoms? Anything? A fall, a car accident, riding a bicycle, taking a long motorcycle ride? Can you remember anything at all like that? All right, let me go back to Facebook here. So you guys, we are live streaming right now on Facebook and YouTube. And unfortunately, the video quality is poor after the fact. And I'm going to have to split Facebook and YouTube up eventually, or I'm going to have to bring in a third internet provider into my office here because it's getting hard. Okay. Because we already have 2 ISPs. All right, I'm going to go back to Facebook and I'm waiting for Supam to say if he remembers any trauma or injury. Yes, come on over to our website, icnetwork.org, and please Google or search on our website for urethral pain or urethral symptoms, and you should find that article, The 7 Causes of Urethral Pain. I think you'll find that very helpful. All right, Diana says, my doctor gave me no information on what to do for my pain with IC. You've been in pain for over a year. I've had a cystoscope and have Hunter's lesions. You just started taking aloe capsules. What can I do to reduce pain in my urethra? Okay, so Diana, the first thing we need to know is, did your lesions get treated? It's important that lesions be treated. 85% of patients, when the lesions are treated, the pain goes away. And one of the great tragedies in the IC world are patients who call me sobbing in pain, and they've been in pain for years, and they have lesions and nobody's ever treated them correctly. That's so frustrating for me. So if you've got lesions, the lesions have to be treated. The urethral pain is different. I would want to know if it's chemical irritation. I would want to know if it's estrogen atrophy. The urethra is kind of like the canary in the coal mine when it comes to estrogen atrophy. It's the first part of the urinary tract to start screaming when estrogen levels drop. And so if you feel like there's a foreign object stuck in your urethra that won't come out, that's a classic symptom of estrogen atrophy in the urethra. Marcella, thank you for the 50 stars. I really appreciate that. Guys, if you appreciate these meetings, DJ, thank you for the 100 stars on Facebook. I so much appreciate that. DJ says, thank you so much, Jill, for your empathy, helping us to not feel so alone. Also, your information and knowledge has been invaluable. Thank you, hon. Thank you. So if you find these meetings helpful and you're on Facebook, you can give me stars, or you can come on over to our website and become a member and get our magazine or buy something from us, whatever. Okay, Subham says there's no injury. I have teeth surgery and some course of antibiotics. After 1 month, urethral syndrome started and still there. Sometimes I feel pain in the urethra. So I gotta say that the teeth surgery is interesting because they have found bacteria normally found in the mouth through different parts of the body because sometimes the blood vessels get opened and the bacteria can travel to different parts of the body. Have you had a next generation urine test? I would want to know if you've had a next generation urine test and to see what that would find in your urine. Nan says, "Hello from the Delta. Totally get the chowing down during these times." Yes. Yeah. What did I have last night? So my normal I've been eating dates at night for dessert. So I will have like 5 dates, which is a hell of a lot of sugar, which is completely defeating the purpose of my resolution of no cookies, cakes, or pastries. I don't know. Maybe if you can think of a better resolution for 2021, let me know. Casey, you, Jill, are positive, articulate, and essential. I've known you for 2 decades, 20 years. Girl, my concern is comments on Facebook about the edge. People who speak about losing it, lost 2 online friends. Please advise admin on Facebook. I will stay tuned. So, guys, this is where Facebook sucks. Now, listen, I started the very first online support groups before Facebook. The IC network was the Facebook 20 years ago. We had a huge forum. We worked with 200,000 patients a month who were participating in our forum online. And then when Facebook came, people started going to Facebook and other places rather than our forum. And that's okay, because frankly, I have other things that I'd like to do. But we had a wealth of experience working with traumatized patients. And my staff who run our forum are all trained, and they know what to do if we've got somebody who is on the edge. Facebook is simply not the case, and I can still remember it wasn't in. No, I take that. Let's see, who was that? I had somebody in one of my live support group meetings in our chat room who had logged in from Facebook, and they were in dire straits, and it did not look good. And all I can say is I spent hours on the phone with Facebook trying to get them to do a welfare check on this patient, because at that time Facebook didn't have any support for patients who were at risk. Now they do. So if you ever see anyone on Facebook or any other website who is expressing self-harm, you have to understand that you're not trained for that. And if you try to intercede, you could say the wrong thing, and something bad could happen. If you see somebody on the edge, you got to get the professionals involved, and you got to use a Facebook reporting and let somebody know that somebody's in crisis. Very, very important. Ellis says, "I'm one of the weird ones whose severe bladder pain begins with urination. Is there a subtype for my people?" Well, Ella, is it as the urine is crossing through? I would want to know, where is the pain? At the beginning of the top of your urethra, at the bottom of the urethra, in the middle of your urethra? That's important. Let me know. Hey guys, give me 1 sec. Let's take a quick bio break. I need to go pee. I'll be right back. All righty then. Okay. Hey man, if there's ever a place where you can just get up and go to the bathroom, it's right here, right now. It's okay. One thing to doing support online is you're home. You're safe. You're comfortable. You can use the restroom whenever you want. All right. Okay. Betty says, "Now you guys on Facebook, listen, I'm 30 minutes behind on your questions." Susie says, "Did I see the NIH article on COVID-19 mentioning cytokine pelvic issues with IC?" Susie, I think I did. I think I did. when I was doing that article. We did an article last week showing all the data that we had collected on IC and COVID, the cytokine storm. But it's hard because, Susie, the other reality here is that we know that COVID can infect the kidneys. We know that live COVID is found in the urine of patients, some patients, not all patients, but some patients, just like it's found in the stool of some patients. And so the question I think that is the most important here, especially for the IC patients who are taken out of flares, is I really have to wonder if the COVID is actually infecting their bladder also. We don't have any data to support that. But what I can tell you, in our survey, basically 75% of IC patients who got active COVID had a significant worsening of their symptoms. 25% reported severe IC symptoms, and then 47% or whatever reported moderate to mild increase in their symptoms. And so I have to wonder if some people are getting COVID infections in their bladder wall, and we won't know that. They won't know that unless they do more testing. Christy said, just got diagnosed with IC. I'm flaring horribly with no relief. Help, please. Doctor prescribed hydroxyzine. So, Christy, it begins with your subtype. We have to try to figure out what your subtype is because not everybody's the same. So for some people, IC begins after having a baby. For others, IC begins after falling on their tailbone. For quite a few people, IC begins after some sort of chemical trauma where they have a chemical trauma to their bladder wall from using ketamine or going through chemotherapy or drinking way too much soda or diet soda or stuff like that. And so, your very first thing, before we can really talk about the right treatment for you, is to try to understand what your unique anatomy is. And normally, when a doctor makes a diagnosis of IC at their very first appointment, they're also checking your pelvic floor muscles. And that's an important piece of this puzzle is what is the condition of your pelvic floor? Do you know? Is it tight? Because it would be pointless to do bladder therapies if your symptoms are being driven by your muscles, just as it would be pointless to do muscle therapy if your symptoms are the result of chemotherapy, other than maybe just trying to keep your muscles calm and collected. Christina said, I have a question about the Elmeron studies. Are there any studies where Elmeron was passed through pregnancy to the baby or during breastfeeding? I took it during pregnancy and 2 years of breastfeeding. I do plan to have her eyes scanned. Oh, I don't know how to answer that question without upsetting you, Christina, and I don't want to upset you. I think it's very important you have your baby's eyes checked. I have worked with one other patient who used Elmeron during pregnancy, and her child was born with really severe vision issues. And so, guys, just so you know, out here, Elmeron as a therapy is pretty much done. It's pretty much over. We now know that it causes retinal damage, in some cases, progressive retinal damage over time. And you should never take any of these meds without really looking at what we call their teratogenic effects. We need to know what the risk to the fetus is. There's only one study that has been done, or one article that was done by Dr. Deborah Erickson at the University of Kentucky. It's in our Pregnancy Resource Center on our website. I hope Christina, I hope you're not taking it anymore. I do. I mean, the good news here is that you only used it for maybe 3 years, but I just don't know, hon. I don't know. That would be a really, really good question for Dr. Jane at Emory, the guy who made the discovery. And you know what? Let me just email him. Hold on a second. Since he and I correspond pretty regularly, I've got his email address. Let me just, while I'm thinking about it. Okay, so here, hold on a sec. Uh, let's see, pigmentary maculopathy in fetuses. Okay, here, hold on a sec. Let's see. Hi, Dr. Jane. I'm doing a live support group meeting right now and have a patient who used Elmeron during her pregnancy and for 2 years while she was nursing. Do you have any reports of children being affected by that? I've only talked with one patient in the last 2 years who did think or did wonder if her child's eye issues were the result of Elmeron. All right, let's see what he has to say. You know, Christina, I think you should go over to the website Elmeron Lawsuits, Elmeron Lawsuits is it .com or .org? I always forget. It's one of them, elmeronlawsuits.com or .org. And call their number and see if they've worked with anybody too, okay? I just had a meeting with them on Friday. That hasn't come up, but they might know. The last count, there are over 160 lawsuits filed with Elmeron and eye disease. Actually, it's probably many more by now. There's probably another 20 or 30 more, since that was a figure from about a month ago. There was bad news. There was kind of a little bit of bad news in the they were hoping that they would be able to combine all the lawsuits in the federal court of Pennsylvania under a specific judge, a female judge who was incredibly proactive and supportive of people who had been damaged and by medicines, et cetera, et cetera. And so they were all the attorneys were quite happy that it was ending up on her desk. But then she has been tapped by Joe Biden for a seat on the Court of Appeals, apparently. And so this case was taken off of her desk and put onto the desk of an old boy, one of the old white guy federal judges, for lack of a better term, who is they were devastated by that appointment. The attorneys, they were devastated that it ended up on his desk because he's kind of known more for attorneys getting a lot of money, but patients not getting potentially a lot of money, kind of, sort of. And so what they're going to be doing instead is filing in state court and bringing a group of attorneys together to file in state court. So we're going to be doing probably another webinar on that in the next couple of weeks with the attorneys to explain what happened there. Subham says, can Kegel exercise help reduce urethral syndrome? No. Kegel exercise could actually make it worse if your urethral symptom is coming from tight muscles, hon. That's why I asked if you were riding a bike or anything like that, because when men ride bikes, the bike seat pushes directly up into their urethra and also, or underneath the urethra, puts pressure on the nerves and things like that. Also, Subham, I would want to know, are you sitting for a long period of time? It's very important that you have a pelvic floor assessment. I would want to know what's going on with your muscles. You had the next generation test, nothing there. Okay, then we're going to have to look at the diet, just like your doctor said. Ignore the foods which irritate the urethra, just like your doctor said. No coffee, no tea, no green tea, no soda, no alcohol for the moment. We got to try to get these tissues to calm down. But now since the bladder looks good, we got to look beyond the bladder at the muscles. We had a big research study that came out last summer that was stunning, because what it showed is that 70% of the men who had testicular pain, had an underlying orthopedic hip abnormality. So we have to look at your muscles and bones to make sure there's not something there that could be triggering some of this. Jill says female cancers run in your father's side of our family. Yeah. So topical estrogen might be the best choice for you because it's so much safer than oral estrogen. Pat says, do you take progesterone with estrogen? The answer is normally you do if you still have a uterus, because it's the progesterone that will trigger a sloughing off of the endometrial lining, aka your period. Because if you don't take progesterone, it will just get thicker and thicker and thicker and thicker. And God forbid you have complex endometrial hyperplasia, which are complex cells that are known to turn into uterine cancer, which is what I had. So you normally use the progesterone to get the uterine lining to thin and to slough off the endometrial hyperplasia. Peg says, homeopathic HGH has helped me feel so much better. What is HGH? I don't know what that is. Renee says, wouldn't it be nice if we could just put estrogen cream on our face to go? There's a lot of blurring powder happening right now. Renee says, I take bioidentical hormones. The way I've been taught over the past 25 years from my hormone specialist is you definitely want to take progesterone with estrogen. Yeah. Brenda got her first COVID-19 shot on Friday. Did fine. Yeah, that's 3 of you now. Doing fine with your vaccine. Susie says, in remission, would like to talk. Would you talk about mast cell and histamine? Cimetidine took my pressure away. So when you have a nice thick protective coating and irritants are getting down here, the one thing you can't see is that there are mast cells in these tissues, and mast cells release histamine, and histamine is very irritating. One of the ways we used to describe IC is it was like 100 mosquito bites at once in your bladder, because wherever urine gets in here, it's going to cause the mast cells to release histamine, and that's what makes mosquito bites swell and become itchy. And so that's why doctors will often put you on an antihistamine or cimetidine to try to control some of that mast cell reaction. That's one of the things that really helped me. My first, I think I took them for 10 years. Visceral. I think I took Visceral for 10 years. Finally stopped it because it started giving me night terrors. And guys, I'm symptom free now. My bladder is good. My bladder, it looks like a baby bladder. There is nothing wrong with my bladder at this point in time. For me, it is all about my muscles instead. My left piriformis muscles are my dominant issue. I am IC subtype 3, pelvic floor driven, IC subtype 5, central sensitization. Shelly says, I've been in so much pain. I passed 3 blood clots last week. It was really painful. I've been dealing with situs for years. I also have a cyst in my bladder. My doctor said it would do more harm than good to remove it. He did a biopsy on one about 3 years ago, and it was not malignant, yet the pain persists. Honey, if you're passing blood clots, that is not normal. If you've got cysts in your bladder that are bleeding, that is not normal. And I am not happy about that. You've been hospitalized 4 times from failure to urinate and kidney failure. Wow. I think it's time your case is complex, and it would, at this point in time, be important to get a second opinion, probably from a national specialist, right? And so if you're on the East Coast, you can go to Robert Evans at Wake Forest University in North Carolina. You can go to Rob Moldwin up on Long Island. If you're in the Midwest, you can go to Ken Peters at Beaumont Health. If you're on the West Coast, you can go see Phil Hanno at Stanford or Christopher Payne at Vista Urology. And there are other other I see research groups that are doing valid research, but man, it is not normal to be passing blood clots, and I would want to know what the hell is bleeding. I mean, this is not normal. If it's the cysts that are bleeding, then they should be able to do a low pressure, short duration hydrodistension and get a much closer look at your bladder wall. And it's at that time that they might be able to just resect those cysts out or cauterize them off. It depends upon how big they are. But I'm not happy that you're passing blood clots. That is not normal. And I think you need to be much more assertive with your doctors and or get a second opinion. This does not make sense to me. And I'm so sorry that you're in pain. I'm so sorry. Hello, Kim. Hello, Mette from Denmark. Ashley says, do you go to the urologist for pelvic floor pain? No, you go to your gynecologist, usually first for that initial assessment, although the urologist can do that too. But then you are immediately sent over to a pelvic floor physical therapist, and they're the ones who will do the full diagnostic assessment and treatment. So you get the actual exam from a pelvic floor physical therapist. Kristen, what are my thoughts on embedded infections? I go over this every week. This is something that the IC world has been dealing with for 20 plus years. There is a small but vocal group of people who insist that every single patient has an embedded bacterial infection in their bladder. That is bullshit, in my opinion. And I say that because I've worked with thousands of patients over the years, and that does not explain the patient whose symptoms began after a long car ride or bike ride, or a baby, or somebody who had symptoms after going through chemotherapy, or somebody who had symptoms because in their urethra because of estrogen atrophy. I do not support the opinion in any way, shape, or form that every patient has embedded infection. However, I do think it's possible. But we can't just consider bacterial infection. We now have very clear evidence from the United States National Institutes of Health, as well as several European studies, which have found virus, specifically the polyoma BK, the polyoma JC, and the Epstein-Barr virus in a subset of patients, particularly patients who have Hunner's lesions. And we also know that fungal infections are absolutely possible. And again, it was our own National Institutes of Health who discovered 5 years ago that many patients who were flaring because they had an overgrowth of fungus in their urine, specifically Candida. Last year, we had a new research study that identified 13 different species of fungi in the urine of patients who were flaring. And the more species of fungi you had, the worse the symptoms. And so the biggest problem that I have with the embedded infection people is that, number one, they don't generally believe in testing. They're guessing as to the right therapy. They're guessing about antibiotic resistance. And most importantly, they're not differentiating between fungal infection, viral infection, and bacterial infection. Now, I will say this. There is a subset of women who have genitourinary syndrome of menopause, whose bladder wall is deficient, and this is now allowing bacteria to reach these cells and infect these cells. And there is a group of women who get recurring infection over and over and over again. And for those women, we have to look at what's fundamentally happening. What the research shows is that the bacteria is usually quite happy in the vagina about 24 hours before it arrives in the bladder. And this was from a lecture I attended by Dr. Anthony Schaefer. And it was all about women who get recurring bacterial infections. So again, what they found in their research is that the bacteria is usually found in the vagina 24 hours before it arrives in the bladder. And that posed the question, what has happened to vaginal defenses? Why has the vagina become a safe haven for bacteria? And the answer comes right back to estrogen atrophy. And so generally for an older woman who's getting recurring infection, not only will they identify the bacteria, identify the correct antibiotic to take, they will also usually give you a topical estrogen to use vaginally to improve your vaginal defenses. Giorgio says, hold on. One thing about doing these is my lips are always dry. So that's why you always see me putting stuff on my lips. It's hard to talk for 4 hours or 3 hours. Jojo, I got a catheter during a procedure before that day. IC was good for years, but after that I had a bad flare-up. Is that normal? Could have irritated your urethra if it was too big, could have triggered tight pelvic floor muscles. It could have introduced a bacteria into your bladder. Hi, Annie. Annie, did the magazine get mailed out yet? No, guys. So the printer that normally handles our magazine had a big break-in. Somebody went in and trashed it. And unfortunately, the machine got broken. And so our magazine printing was delayed about 10 days, but you should be getting it this week. Richard says, what is the treatment for chemical trauma? Number one, well, if it's from chemotherapy, there is a specific medicine that they can give you that will break down the ingredient in some chemo that will cause bladder irritation. So number one, let your doctor know that your bladder is being irritated because there's a medication they might be able to give you depending upon the type of chemo that you're having. Okay, so that would be number one. Number two, we have to try to figure out what the irritant is. If you're a diet soda drinker, et cetera, that's what we got to change. Because seriously, if you're continuing to drink diet soda or coffee, your bladder's not going to calm down if you've got a chemical injury. Then we've got to create an environment that will support healing. That means you got to follow the diet for at least 2 to 3 months at a minimum. The bladder is the slowest healing organ in the body. Absolutely nothing's going to happen overnight or in 2 weeks. You got to give it months for it to calm down and heal and repair itself. In that meantime, in the duration, doing something that has a coating effect that might provide a little bit of extra protective coating to the bladder would make sense. And that's where Elmeron used to be helpful. But of course, we're really not doing Elmeron anymore. Most patients have turned to chondroitin-based supplements because chondroitin provides a bladder coating effect. So let me show you what those are. Hey, Donna with the hysterectomy, I'm going to come to that next, okay? Hold on. All right. So let me show you what these supplements are so that you have some context. Okay, so if you were to look at the American Urology Association guidelines for IC, you would see in step 1, you remember they have 6 steps of treatment. And again, the steps are arranged with the risk of adverse event. They don't want you to do the hard stuff like surgery before you do the easy stuff. And you'd be amazed how good some people do just by changing their diet. You know, they just don't understand that they're older and their bladder can't defend itself anymore. All right. But the AUA encourages patients to try supplements. Why? Because the supplements carry far less side effects than the traditional medications. Elmeron, of course, we know it's notorious for causing stomach upset, bowel upset, hair loss, and now we know retinal disease. Elavil comes amitriptyline, which is another oral medicine, can cause dry mouth, dry eyes, weight gain, et cetera, et cetera. And the installations too come with their own side effects, like DMSO can give you a strong sulfur smell. So again, the AUA says, let's try the supplements first because they have fewer side effects. So generally, the supplements that are used for people with a bladder wall defect are going to be a chondroitin-based supplement because it's chondroitin that provides that protective coating. And so if you can see this picture, this is an Elmeron. Oh, let's see. Okay, so you can see this. What they believe Elmeron does is put a protective coating in there to cover up these wounds. See, there's the word Elmeron. But we actually think chondroitin does pretty much the same thing. So the top supplements that are chondroitin supplements are going to be Bladder Builder. And this is the top one because it also has a pain-reducing effect with the ingredient of PEA. We just did our 1-year follow-up study with this. This is a fairly new product. 60% of the patients using Bladder Builder report fewer flares, less intense flares, shorter flares, and about 25% of them are pain-free using Bladder Builder. But 40% of patients did stop using it because either they couldn't afford it or their doctor wanted them to do something else, or they had a gut-issued side effect, which any of the supplements can cause. Generally, the most common side effects with supplements are going to be gut distress, stomach upset, diarrhea, things like that. Okay, so we got Bladder Builder, Bladder Rest. Bladder Rest is a really simple, clean, pristine formula for people who are super sensitive, and it's in an avocado oil base rather than an olive oil base, which makes it a little bit more heat stable. So if you're super, super sensitive to stuff and you want to try, but you want to start with something really easy, then Bladder Rest would be viable. Of course, the old standby was Cystoprotect. Cystoprotect had been around for 25 years. It was created by Dr. Theoharides, a federally funded IC researcher at Tufts University. And he's the one who really revolutionized supplements, and he's the one who understood the coating effect of chondroitin and another ingredient called hyaluronate. So Cystoprotect was the top supplement for 20 years. I mean, oh my God, it was the best of the best. I took Cystoprotect. Unfortunately, they had a cancer warning debacle 2 years ago, which pretty much almost destroyed the brand. That's all taken care of. Cystoprotect is back, but they lost a lot of customers who went to some other products instead. But if you did well on Cystoprotect, it is back. We couldn't get it for about 10 months. So we got Cystoprotect. We have a new variant called Cystomend. And Cystomend is like Cystoprotect, virtually the same ingredients with the addition of pumpkin seed oil, and it's $6 cheaper, $43 rather than $49, $48.99, somewhere in there. So Cystomend is viable. We have Cystorenew. Cystorenew is created by Dr. Gio Espinosa. His website's drgio.com. He's the head of integrative urology at NYU. And what makes Cystorenew very interesting is that it added, in addition to the chondroitin and the collagen, it added lemon balm, which is a mint with a lemony scent, but lemon balm, so it's not citrus lemon, it's a mint with a lemony scent. Lemon balm is known for calming nerves down. And so Cystorenew was very popular, but again, now we have Bladder Builder, which also calms nerves down with PEA. We had a big research study that came out 2 years ago at the American Urology Association with an ingredient called palmitoyl ethanolamide, also known as PEA. PEA has been used in Europe for decades for chronic pain, lots of different pain conditions, from fibromyalgia to sciatica to burning mouth syndrome, et cetera, et cetera. And so the Italian research community did a study of PEA with IC, and the data was nothing short of astonishing, because it showed that by month 3, 87% of patients using PEA had a significant reduction in their pain, and by month 6, 25% were pain-free. So that formula in Europe was called UMP. We can't get that here. So Natural Approach Nutrition created a similar formula called Peora, Peaora. And this is what I take when I start feeling funky. So there's no bladder coating effect, because it is just simply a nerve calming effect. There were no side effects to PEA reported in the IC study and in most of the studies used with PEA. We also now have a new aloe called Allopath. And so this is organic anthraquinone-free aloe combined with PEA for pain relief. And so this has replaced Desert Harvest aloe in our store. And I'm extremely excited about this, because aloe is known for being calming and soothing, right? And it has a place. Some people really like aloe. One of the challenges with aloe, though, is, again, like any of the other supplements, it's known for a bit of gut distress. But aloe's place in the IC movement is really about calming and soothing tissue, especially like the urethra. And the reason why we transitioned to this is because it enhances that soothing effect with the addition of a pain-fighting effect. And so Allopath is aloe with PEA in it. And then, of course, we do have a low acid multivitamin. And one of the other big research efforts that are kind of going right now is we're finding some B12 deficiency in a lot of patients, and more to come on that. We've been talking about that for years. I did a big article on that about a woman named Barbara Flanagan, the founder of the original ICA, who's been pursuing this for decades. Anyway, if you do need a vitamin, you can do Bladdersmart, which is a low acid multivitamin. So again, this is what I take at night. I take 2 every night. You can take up to 3. And then last but not least, we have Prevent. And this is a cranberry proanthocyanidin product, a PAC product for people who find themselves to be prone to UTI. And so this is like Allura. So this is PACs combined with D-mannose if you find that you are prone to infection. But again, not everybody's prone to infection. So anyway, those are the options. Those are your therapeutic options there when it comes to supplements. Okay, I got to get to Donna here, and then we're going to be starting our Zoom meeting shortly. Donna said, I've recently had a hysterectomy due to cervical cancer. They did get all the cancer, but now my bladder is going crazy. I was doing so good before the cancer. I was doing pelvic floor therapy and doing great. I had an installation, and it did help. Any suggestions? So I guess, Donna, question number 1 is, did you go through chemo, or did they just do the surgery? If they just did the surgery, I would like to know when that happened. Hysterectomy, it really does take a year to recover from hysterectomy. Hysterectomy is a fairly brutal procedure, and when you have cervical cancer, obviously they're going to take the cervix. They took my cervix too, and so you could have what is it called? Vaginal apex pain, which I have, where the incision that they sewed together where your cervix was becomes incredibly sensitive. So I would be looking at that. But the other reality is if they took your ovaries and you're now not getting any estrogen, you're going to be in estrogen atrophy. And that would explain why your bladder wall is not happy. Girl, I've been there, 3 years ago, I was exactly at the same place. So, it's interesting with the hysterectomy, the phases you go through in recovery are fascinating, because like the first 6 weeks are just like shock and awe of just trying to get through the surgery, and the trauma and the pain and being able to move and walk. And those are 90-day sutures. So those are fresh sutures for 90 days. So like, you've got very important things you cannot do. You should not be bending over and lifting things, anything at all like that, because you could rupture a suture. Normally, when they do hysterectomy, they also do a hydrodistension afterwards to make sure they didn't accidentally perforate your bladder. I've worked with one patient who had a suture perforating her bladder, and once they removed the suture, the bladder pain resolved. And so, it would be very reasonable, given the fact that your bladder's going crazy, to let somebody take a quick look at your bladder to see if there's any chance that you've got something intruding into your bladder like a suture. Absolutely possible. And then the third thing too is really pelvic floor spasms. I had 10 months of levator ani spasms, but they manifested in a very unique way. It felt like there was a fist up my vagina that was grabbing onto my tissue and trying to pull it out of my body, especially when I sat down. If I sat down hard, like you sit down hard getting into your car, it's like, oh, holy hell, what was that? And it was this pulling sensation. And that was an involuntary levator ani spasm. And when the doctor finally saw it, he sent me to physical therapy, and that's what turned it off. It took 3 physical therapy appointments for that to turn off. Hi, Ruth. Shannon, yes, this is always recorded on YouTube and Amazon, but the video quality won't be very good, but the audio should be okay. Christina says, I've been diagnosed with pigmentary maculopathy in May. I was first diagnosed with macular degeneration until I gave them the documentation from the network. Christina, I'm so sorry. I hope listen, if you're not involved in a lawsuit yet, I encourage you to get involved. Go to elmeronlawsuits.com or elmeronlawsuits.org, and, that's the team of attorneys that, we've been working with. I've trained a lot of attorneys in the last year in IC, let me tell you. Ashley, what do you think about Botox for IC? Botox therapy into the bladder wall is a step 4 treatment option in the AUA guidelines. Botox works by numbing, basically deactivating nerves for a period of time. So generally what they do is they just randomly space injections into your bladder wall. And unfortunately, if they numb enough nerves, it could also turn off your ability to urinate, and you might need to self-catheterize for a period of time until the Botox wears off. There are also some pretty severe side effects with Botox. We worked with somebody last week, a pretty bad reaction to Botox. I don't remember what it was, but I actually worked with a lady who went into heart failure an hour or two after Botox because it got into her bloodstream and it started to turn off her heart. And she was in the ICU for a couple of weeks as they got her heart functioning correctly again. So Botox is not without its risks. Christina, you're still taking Elmeron? All the experts say that if you got pigmentary maculopathy, you should stop the Elmeron. Oh, you stopped taking it in April when okay. I'm sorry, I take that back. Shannon says, what are people taking instead of Elmeron? They're either doing bladder installations that provide a coating effect, or they're taking the supplements I just showed you guys. Faye says, I get terrible pain and irritation on my vulva, but sometimes I think that might be caused by my urine. This recently happened, and I decided to clean my vulva with wipes I buy. After 2 or 3 days of cleaning the vulva with those wipes, the pain and your irritation went away. So important to keep the entire area clean. And Faye, again, remember estrogen atrophy. Pat says she got her COVID shot 2 weeks ago. No issues. That's a 4th person in this meeting. No problems with the COVID vaccine. Oh, HGH, human growth hormone. Right. I should have known that. Sorry about that. I don't think I have any data on human growth hormone and IC. I not off the top of my head. Susie says, loves physical therapy, pelvic floor, a special breed, life changer for me. Yeah, life changer for me too. Susie says we have to de-yeast and balance our guts. We got to eat correctly, but we certainly do not do colon cleanses. Colon cleanses will only make things worse. And please, God, no coffee enemas. Oh my God, no. Hi, David. Ruth says, what do you recommend at the same time in terms of supplements? Well, if you take more than one supplement at a time, you're not going to know what's going to work for you. So generally, it's a one at a time crapshoot. You got to pick one and give it a shot. And so generally, most people are starting with Bladder Builder now, unless you're super sensitive. If you're super sensitive, then you can pick any of the other ones. Shanna says, I have Premarin. Is it okay to take? It's a cream. Premarin, give it a shot. The challenge with Premarin is that it just has a lot of preservatives and chemicals in it, which can cause some extraneous irritation that a simple compounded estrogen cream would not. And so doing a compounded estradiol might be better for you. Deb says, I started Bladder Builder just before Christmas at the dosage on the bottle, way too much. I dropped to 1 a day, added B complex. Amen and hallelujah, you're symptom free. Oh, good to hear it, hon. Good to hear it. All righty, it's time to do our Zoom meeting. And this is where you can come in and ask questions. Facebook and YouTube is going to stay on, but you're only going to see my pretty face. You're not going to see the people talking. The people in the Zoom meeting will be able to see each other. So let me start up this Zoom meeting. The way you can get easiest way to get into the Zoom meeting is just go over to the IC Network website, icnetwork.org. Click on the support pull-down menu, go to the second option, stream support group meetings. And you can see the Zoom meeting right there as under the YouTube channel. So let me just start up the meeting. Oh, let's see here. All righty, the Zoom meeting has been started. Let me get the invitation. All right, YouTube, I'm going to give you the invitation. And Facebook, I'm going to give you the invitation. All right, so anybody who wants to come into Zoom, I'll let you in one at a time. Angela says she has COVID. I'm so sorry, Angela. I'm glad it hasn't hurt your bladder. And if one of you are calling me right now, I cannot answer the phone, obviously. Come into the Zoom meeting. Mary says she will have to cath herself for the rest of her life because of what the Botox did to your bladder. Ye gads, girl, I'm so sorry. Honestly, Botox has never appealed to me at all. I just, as a therapy, it just hasn't. All right. Now, hold on a sec. I got so many windows open. Hello, Beth. Beth is coming in. Hi, Beth. All right. So you guys, if y'all want to do Zoom, that's fine with me. If you don't want to do Zoom, that's fine with me too. I am at your pleasure here. Well, hi there, Beth. Okay. How are you doing today, hon? How is life? Can you, let's see, I got to turn up my volume here. That's not you. That's me. What's going on? What can I help you with?
I just received my supplements. I'm a new member. I have just challenged time with endometriosis and trying to figure out if I've got a structural problem or an injury from kidney stone removal last year and a stent, which was just beyond a nightmare, like I can't even describe. And trying to figure out how much of it's IC, how much of it's injury from that irritated even worse. And I just had a total hysterectomy and wondering now how much of it's estrogen atrophy because my urethra is very troublesome, and how much of it is like I've had so many surgeries that I'm just starting to wonder now. When you talk, it's really opened my eyes about thinking about it as an injury versus I've got this condition that none of my doctors have any clue whatsoever about.
Right.
And so you just said I was going to ask you the question about when I should, like, what supplements should I take? And it sounds like you just said to start one at a time.
Yeah, but when did you have your hysterectomy?
I had it in 2019.
Okay.
I've since then had 2 surgeries since then to have kidney stones removed, which is why I'm potassium citrate. Trying to figure out how much that might be irritating. It's like this whole collection of, I don't know, like we more to start, I guess.
So when you had your hysterectomy, they should have been able to tell you if you had endometriosis on the outside of your bladder. What was the status of the endometriosis?
Well, I've had, I don't know, 6 or 7 cleanup surgeries and finally ended up having a total hysterectomy. She called me, quote, together, like everywhere, like around my ovaries, my rectum, my colon.
Okay.
She found appendiceal cancer, which it actually saved my life.
Wow.
But like it was just everywhere. And she said 5 to 10% of people continue to grow endometriosis even after they've had everything removed. And I think I'm one of those people. So I think the endometriosis is growing again. And I feel like the reason I'm wondering if it's like a structural thing or endometriosis thing is that the spasms and everything seem to be very specific on the right side.
Okay.
Whereas it never used to be that way. So that's why I'm just, I don't know. Since I've discovered you like 3 weeks ago, I was just like, I just listen and listen and listen. I cannot believe the information you have. Thank you.
Yeah, well, you're welcome. So, so you are in a, gosh, what can I say? You're in the worst situation you can be.
Hell.
Yeah, because you have your endo wrapped around everything down there. You've had multiple surgeries. You have multiple traumas.
Kidney stones.
Kidney stones. I would assume that your central nervous system is quite amped up. I would assume that you're probably dealing with some anxiety on top of everything now too, because you've just gone through hell and your body is.
I can't. My biggest problem is I can't sleep. Like I get up to urinate many times a night, and my sleep is like it's horrible, and that's like actually my greatest concern. Like you can't go forever without sleep.
Is it your urethra that's keeping you awake at night, or is it your bladder?
That's what I'm starting to wonder since I've been listening to you. I'm going to talk to my gyno. I've got an appointment in February I made to get this cream that recommending, and I'm going to start there, I think, because I really wonder. My urethra absolutely bothers me, and now that I understand this estrogen atrophy bit, because I'm not on anything, because my oncologist didn't want me on any hormones because I had this cancer.
Right. And what kind of cancer was it again? What was it again?
Appendix.
Oh, it was your appendix. Wow. That's crazy.
My gyno just had a hunch about it, and she took it out, and it ended up being malignant. So they found it like in the very beginnings of stage 1, and it's usually like ovarian, where it's not discovered till stage 4.
Okay.
It's like in one in a million people. So, but so anyway, the bottom line being, I wasn't put on any estrogen or any kind of HRT or anything because of that. But now I'm really wondering, like when you said just earlier, how your skin is aged, like that's me. It's like, I just like went like, wow.
It's like 10 years in a year. I mean, the changes are amazing.
And literally after my hysterectomy, the labia, everything down there, just like, it's just like went flaccid. And so now I'm really just wondering if that's such a big part of it. So I guess that's where I'm going to start. But in the meantime, I got the Bladder Builder and all that.
Well, I mean, the Bladder Builder, it was going to be really interesting to see how you do with it. But there was it's like every 2 or 3 months, there's a new article, a new research study on the safety of topical estrogens and how much harm is being done by women who have been told not to use it because of a pre-existing history, when in fact they believe that it carries very, very little risk. And so
the cream you're talking about, right?
The cream, the topical cream. Now, I attended the International Pelvic Pain. Okay, so this is an interesting point. So I attended in October the International Pelvic Pain Society meeting, and one of the speakers there, they also talked about topical estrogen, but what they said is that there is less absorption if you use it on the outside as compared to putting it up at the end of your vagina. And so that would be another thing, another argument that you could, or not argument, information you could use with your doctor to say, listen, if I just use it topically, if I just rub it into the entrance of my urethra, what do you think the risk is of that? I mean, the cancer they found in your appendix, was it hormone sensitive?
I'm not aware. It was called a mucocutaneous neoplasm.
Let's look at it real quick. Hold on a sec.
It's extraordinarily rare. So
okay, so it was a mucocutaneous
neoplasm. Appendiceal.
The heterogeneous group of tumors with a rising incidence. Treatment is based on stage and histology. Low-grade tumors are treated surgically. Fascinating. It's a rare malignancy with symptoms varying. Hold on. Let me just look at one other thing. Have you ever been to the National Library of Medicine?
It's not the NIH, right? No, I don't think so.
PubMed.gov. Like publication, PubMed.gov.
Yes.
I would go through the research and see what that says.
Yeah. What I do know is not sleeping ever. Like, I'm gonna die of that anyway. So I'm willing to try the cream. I think regardless, you can only go so long without sleep.
I get it. Wow, this is fascinating. Okay, I have to read up on that. They say that it's a rare manifestation, most often identified as an incidental finding. Endometriosis leading to obstructive mucocele of the appendix is an exceedingly rare finding, having only been described 12 times in the medical literature. Wow. Hey, you're special.
I know. That's why my oncologist said, if you're going to look for a specialist, he said, don't bother. There aren't any.
Okay.
So,
let's just operate from the assumption for estrogen atrophy. Okay, that's guess number one. And so as you pee, does your vulva burn? Do you have pain on your vulva as you're urinating?
no, I would say not. No, not generally.
Okay. Do you have any other weird symptoms? Do you feel
I can't empty my bladder is probably I can't start my pee and I can't get my bladder empty.
Okay,
so
wait. So,
getting up.
Okay, so you can't start your urination. What happens? I
just sit there and wait.
So
and then it piddles out. Sometimes it comes out okay, sometimes it doesn't. I do wonder how much it's got to do with how much how like full my colon is, how full my small intestines are, and whether I've had good bowel movements, because bowel movements seem to irritate it if I have a lot of bowel movements, but yet after that I kind of feel better. And if I get constipated at all, I think there's extra pressure in there that's putting extra pressure on everything.
But you're missing the fun floor muscles.
Yes, yes, again, yeah. Since listening to you, 100%, I need to go see a pelvic floor therapist.
You do.
I get my first vaccination tomorrow, but yes, I'm absolutely clearly got pelvic floor problems.
Right. Yeah. And the odds are, because you had so many surgeries, your muscles have been locking down for years. And
there's scar tissue everywhere in there. I mean, just everywhere. I've got like a circle on my stomach with scars. It's just like I've got like that, and I'm 50, almost 53, and my surgery started when I was 25 or 26.
Are you on the? Have you joined the Endometriosis Association?
I just did last week.
They're wonderful. Okay, they're absolutely wonderful, and I mean, like, literally a stellar nonprofit. The IC community could use one like the Endometriosis Association. They took a different tact. They were very, very lucky. Early on in the 80s, they found that first study that showed that dioxin caused the development of endometrial tissue. And I think
no one's ever told me that. It's so depressing.
So dioxin is the most toxic chemical produced by man. It happens when you burn plastic. And of course, it goes out into the environment. It accumulates in the grass. The cows eat the grass. It then accumulates in the milk, et cetera. And it was a dioxin industry that were doing toxicity studies. They wanted to prove that it was safe, and they were doing a colony of monkeys. And a monkey died, and they did an autopsy, and the monkey was filled with endo. And then it happened again, and the monkey was filled with endo. And they published a paper in this little arcane chemical safety journal. And the Endometriosis Association people found that study. And that was the first hint as to what could cause endometriosis, because back in the 40s, there were like 30,000 patients around the world. Today, there are millions of patients around the world. Why? And we believe that it's chemically driven. So anyway, what they did is they petitioned the National Institutes of Health to do laparotomies on all of the monkeys before they were sold off for other research, which is devastating. Again, I gave up that career. And what they found was that it was dose dependent. The more dioxin the monkey was exposed to, the greater the endo. Okay, and so man-made disease, essentially. Every year now they add more chemicals or estrogen mimickers. the odds are either you or your mother to a lot of a estrogen mimicking chemical. So number one, the reason why I go through that is it's very important that you understand that you did nothing wrong. None of this is your fault in any way, shape, or form. And you have a huge sisterhood of millions of women around the world who are going through the exact same thing that you're going through. And the Endometriosis Association is going to give you good, solid info. One of the very first things they tell patients to do is you got to get rid of all the chemicals in your home. No scented candles from China, no scented candles, no Febreze, no room spray, no oven cleaner. Every single chemical has got to be gone. And that makes it hard when you're buying furniture, because furniture is often coated, especially foams, with stuff. So got to clean up your home really, really clearly. Okay, do your best with that. And if that means buying or refinishing your sofa rather than buying a new sofa, definitely do that. It's worth it rather than bringing a toxic something into your home. Okay. That said, now what are we going to do about your pain and your symptoms? The Bladder Builder is a great choice for you because it's got the pain fighter in it. It's got the PEA in it, and it will protect your bladder wall with the hormone estrogen atrophy, and it should help your urethra. So the Bladder Builder, that's incredibly viable for you as an option. The topical estrogen at the urethra, important to consider. But remember too, your skin can't defend itself because it's thinner anyway, right? And so the second thing we got to look at, is there anything else touching your urethra that's triggering your urethral pain? Like, for example, do you wear a mini pad?
Never.
Okay.
I don't even wear underwear. Never.
Okay. What soap do you use? What bath soap do you use?
Like homemade, like homemade soap, no brand.
So,
what do you recommend?
Basically, let's see, Dove or
Dove unscented?
Yeah. I have to go out into my garage to get a sample of the other soap. Dove unscented is what I use, or Basis soap for sensitive skin. And we have.
I saw that on the website. Okay.
Right. Okay. So, and you cannot use any fabric softeners, even on your sheets. Right. If you go to bed without underwear, you can't use any fabric softeners on your sheets. What laundry detergent do you use?
I use an unscented. Now, just like in the last probably 6 months, like I'm giving up all scented everything. So some unscented something.
Oh, 7th generation free and clear. Okay. So 7th generation free and clear right now is, and then we also have this one. We're really, really, really sensitive. You could even try an Echo Egg, and an Echo Egg is a mineral cleanser. So it's an egg like this, and there's pellets in it that pull the dirt out and will clean everything, but there's absolutely nothing else in it that would cause an issue. So this was developed in the United Kingdom, and it's
for laundry.
Yeah, for your laundry. I used it for about a year, and then I don't know. I mean, it was fine. It's a great way to save money. I mean, you get like 210 washes for like $25. So, I mean, so if you had eczema or something like this is what they recommend in Europe now for people who are super sensitive. I think it would be interesting also to try a little bit of aloe. We had a young boy, 4-year-old, diagnosed with IC. This was early on, like 20 years ago. And the only thing he could tell his mom is, my pee-pee hurts, my pee-pee hurts. And they were able to figure out that it was his urethra. And they gave him Mike's aloe juice? That, it's that, no, George's aloe juice. George's aloe juice was the one thing that calmed his urethra down. And that's kind of what aloe is kind of known for, is kind of being calming and soothing to the urethra. And so playing a little bit with aloe, either the Allopath or the Desert Harvest aloe, would be interesting. Are you using any topical creams down there? Anything at all like that?
I use a water-based lubricant. Without that, I don't think I could manage.
So what about coconut oil? So the advantage of the coconut oil is that it has a natural antibacterial, antiviral effect. And you're
talking about the extra virgin coconut
oil
that you get like at the store. Okay.
Yeah, the big tub.
Yeah, I have that.
Yeah, yeah. So that would be viable. And it'll be really interesting to see if the PEA helps reduce your pain, because if it does, then there you go. That's going to be what they can do until your nerves calm down. Your nerves have taken trauma after trauma after trauma down there. Your muscles have taken trauma after trauma after trauma, and you have taken trauma after trauma after trauma. And there is an emotional. Did you go through the emotional stuff that we normally go through after hysterectomy? Like 3 months later, you just start crying because you feel like you're lost your womanhood, or that having children, or.
Well, I think I went through that a long time ago because I wasn't able to have kids, and I just, surgery after surgery after surgery.
Right.
So, and just inept doctors. And I've got a great gynecologist in the Chicago area. That was the only doctor to ever truly actually give me a chance and listen to me.
Yeah.
So,
yeah.
But yeah.
So me too.
So the only other question, I'm the person that asked about the potassium citrate, and I've recently read that they test for ID doing a potassium wash or something, which is why I asked the question, because my doctor has me on copious amounts of potassium citrate to try not to get any more kidney stones, because the kidney stones destroy my bladder and everything. Like getting stones out is a big problem.
Do we know why you're getting kidney stones?
We've done urine tests. I've got high calcium in my urine.
Are you doing a lot of pre-leaf or something, or Tums?
No.
Good. What about, do you drink a lot of almond milk?
Never.
Okay, good. Do you eat
I've been eating a low oxalate diet for quite some time.
Okay.
But my oxalate came back fine in my urine most recently, but I have very high calcium. But I also wonder how much of that. They put me on Lupron, which I don't know if you know what that is.
I do, yes.
They put me on that at 42, and I have to and when they put me on that at 42, my estrogen stopped overnight. Then they put me on copious amounts of calcium supplements, calcium carbonate, that was a major mistake.
Yeah.
And I've been getting kidney stones ever since. So I don't know if it's just, with the Lupron, if I'm just, my bones are getting weaker and I'm excreting calcium. I know that having acid load in my body is important for that now, just recently learning that.
Yeah.
To not excrete as much calcium. So I'm just trying to trying to manage so many things.
When was the last time you threw a stone? Are you doing it all?
I had 2 surgeries last year to get out about a 1/2-inch kidney stone. It took 3 tries basically to get the whole thing out. Wow.
And
then the stent by far the worst pain I've ever had in my life.
Yeah. Do you still have the stents, or did they take? Yeah. Yeah. You're not I've worked with the same experience with the stents.
Oh, the stent was just ornament. With the IC. Otherwise I don't think it would have been that bad.
Yeah. Well, so yes, potassium can irritate the bladder significantly. It's no longer used as a diagnostic test for IC because pretty much anybody with a bladder is going to react to high levels of potassium. And so it's not the same as eating a banana. Eating a banana is a tiny amount of potassium as compared to the massive amount they use in a potassium sensitivity test. And so, yeah, I have to wonder. So
it's supposed to take 3 big capsules of it every day, and it's like 10,080 milligrams per capsule 3 times a day. It's just crazy. Even my pharmacist said, are you lowering your potassium? Why are you supposed to take this much potassium? But I guess it's pretty standard protocol to help reduce kidney stones, but I have to wonder if it's contributing to my IC problems.
It would, given the fact that you've got estrogen atrophy, given the fact that you've got much less mucus in your bladder wall, I think that's a fair assessment to make. I guess at some point in time, you would have to talk to your doctor about, can you possibly reduce the dose for
I got off it. I'm doing my own experiment because it's just been so bad.
Okay. And how long have you been off of it now?
I think about 3 weeks.
And how changed anything?
I think it maybe, but again, some days are just terrible and some days just aren't terrible. And I keep food diaries and I just can't seem to make the connection anywhere.
Well, okay.
Endometriosis.
So we got 3 separate issues going on. So let's just separate it and make it easy. Okay. Estrogen atrophy is real. You've been in menopause since you were 42 and they put you on Lupron. And so the odds are your tissues are very thin and dry. And so the coconut oil should help on the outside. Ask your doctor, you can use a little bit of topical estrogen at your urethra. That could fix everything. If I mean, it did for me. And so if rubbing a little bit into the entrance to your urethra will fix, it's absolutely worth a shot. Talk to your doctor, do your research, go from there. Okay. Now with the endo, the good news here is the endo did not perforate your bladder and did not enter your bladder, correct?
I do not think so, no.
Okay, so we don't have to worry about that. Yes, you've got some adhesions. And so the third piece of this puzzle is what's going on with your muscles. And if I were to guess, I think that your muscles are probably driving a lot of, because when you've got tight muscles, you've got ischemia, you've got oxygen deprivation, right? And so with all the surgeries you have, especially when you've got pain on one side, I always say to patients, if you got pain in one spot, that's where we have to be looking. You got to go to your doctor and say, what is at this location? Because that's not IC. IC rarely has a spot. IC pain is centered in a straight line from your belly button down. If you got pain to the right or to the left of center, we have to look at that location and look for scar tissue, look for more likely trigger points. And so I think it's important that you go have a muscle assessment and see if they can check that out. So you got some really good things to try. You got 3 really good encouraging things to try.
Is there one more question? Is there anything I can do until I feel comfortable with COVID that I could try on my own in regards to the pelvic floor? TENS unit.
Well, yeah. Well, do you have the book Breaking Through Chronic Pelvic Pain yet?
I just got it.
Okay. So the first thing I want you to do is I want you to read the first 4 chapters and try to visualize that location. Can you describe the location for us a little bit more?
Just to the right of my.
Is it above your pubic bone or behind your pubic bone?
Well, I think it hurts in multiple areas, honestly, but the part that confuses me, I think I get the most of the pressure and pain on the right side of my urethra, kind of up. But when I'm laying like in bed on my back, and if I push on my, like if I'm kind of giving myself an abdominal massage, kind of. If I push like where my right ovary used to be and over to that side, if I push on that, it actually spasms my bladder. And I'm not anywhere near my bladder, but on the left side, it doesn't.
Okay, so that's probably tight pelvic floor muscles.
Oh, really? Way over there?
Yeah. Your muscles go all the way to your hip bones. They go from left to right to high. So, I mean, that's a guess. Remember, I'm not a doctor. That's extremely suspicious for tight pelvic floor muscles. So my guess, you've got maybe a tight piriformis muscle. Do you ever have sciatica pain in your leg?
I used to, but I can manage that pretty well these days. I'm lordotic in my low back, and I've got scoliosis and all that.
You have scoliosis too? Girl, we are sisters. I have scoliosis too. Okay, so we have to stay in touch. I want to talk to you some more, okay? So if you could pop me an email, let's stay in touch, and we can talk a little bit offline about some of the other options to go through. And again, the most important thing I want you to hear from me right now is that none of this is your fault. I don't want you carrying any shame or blame. I don't want you feeling like you're damaged goods. I don't want you to feel like you're unworthy or unlovable. Girl, you are hurt. You're hurt. And the good news now is we understand the different types of hurts that can happen, and we can treat them. So there's a very good chance with a little bit of that topical estrogen, we can get your urethra to calm down. But the giant missing piece here, the most important thing for you to do is to go have a pelvic floor assessment. You have to go have a pelvic floor assessment and get them to focus on that right side. Okay. Okay. Where do you live? What state?
I'm in Chicagoland. Suburbs of Chicago.
So you have one of the best physical therapists in the world, Rhonda Cotterinos, who's literally the physical therapist who changed the IC landscape when she went to the American Urology Association and said pelvic floor physical therapy helped people. Her name is Katerinos, Kotarinos, Rhonda Katerinos. Look at her clinic. She's south of you just a little bit. And then go to pelvic pain.
Oh, I know exactly where she's in Oak Brook Terrace.
Yeah.
Oh my God, that's amazing. Thank you.
Yeah. Yeah. Tell her I sent you. Tell her I sent you and get her to focus on that right side. And it will be, I mean, she literally was the first physical therapist to come to the AUA meetings to teach doctors how to evaluate the pelvic floor. So if anybody's going to figure out what's going on with your pelvic floor, it's going to be her, okay? And listen, when you go, what they do is they evaluate your pelvis. They're going to start externally. They're going to look at how you're walking, your hips, all that sort of stuff, your butt, your core. They're looking for muscle tension patterns. But when she does the internal examination, and God knows, girl, you've had tons of internal examinations. If she can touch something and trigger your pain, that is your hallelujah moment. That is exactly what we want. If she can touch something and trigger that right side pain, we found it. And there's really, she's exceptional. And she's a champion for IC patients because the doctors laughed at her for years, but now guess what? She teaches them. She's one of a small handful of physical therapists who is assigned the task of teaching urologists about this. So go for it, okay?
I'll call her tomorrow. Thank you so much.
You are very, very welcome. You keep in touch. Send me an email, okay? icnetwork@mac.com. I want to keep in touch because we are sisters in many ways. Okay. Now I know we lost somebody. Okay, guys, I'm just going to randomly pick. Don't take it personally. I'm going to go to Christina next. Christina is laying in bed or on her couch.
No, I'm just sitting here on
by the
front of my fire.
How are you doing today? How is life?
It's okay.
Okay. How are your symptoms? How are you feeling?
Oh, I got a whole slew of issues too.
Okay.
Not as this other lady here. I'm from Canada.
Okay.
I also went down the embedded infection route. I went all the way to England to see that doctor, which was a colossal waste of time and money and actually made me worse.
Okay.
So that's out of the question for me. I got diagnosed with IC apparently from a doctor about December of 2016.
Okay.
And I was getting recurring bladder infections chronically all the time. Bladder infection after bladder infection never stopped.
And how long? Okay, so I'm going to stop you and ask questions. Okay, just bear with me because it helps me understand. How long had you been having the recurring infections? Most of your life?
Forever.
Since you were a teenager?
I started getting them probably when I was in my later 20s, maybe.
Okay.
And then I started getting them quite often, but then it was probably, I don't know, around my 40s, early 40s, when I really started getting them chronically, constantly all the time. And it was to the point where I was getting one basically like almost every month, chronic bladder infections.
And what was it? What was the bacteria? Did they identify the bacteria?
Well, that's interesting because no one ever told me. They just kept saying, you have another UTI, you have another UTI, you have another UTI, you have another UTI. And the pain would get so excruciating. So I went to my GP and I said, listen, I can't keep leaving work. I'm a child, in Canada, I don't know what you guys call it there, Child Protective Services. I do child abuse investigations. So I'm talking. So I couldn't keep leaving my job and going to the hospital all the time because I was getting these chronic urinary tract infections. So I had my doctor sent me to a urologist. I knew nothing about interstitial cystitis. I'd never heard of it before. He was a male doctor. He right away said to me, you got to go in for hydrodistension. We need to go in there and look. And so I didn't know any better. I listened to him. I did what he said. I got the hydrodistension, which was an absolute nightmare. He said to me, you probably, just from your symptoms, you must have interstitial cystitis. So I said, okay. So I listened to him. I got the hydrodistension done, which did nothing for me. He put me on Almiron, which I almost got into a car accident because it made me very, very dizzy. I was actually having issues kind of getting blurry vision from it right away.
Okay.
So then he said to me, we're going to do bladder installations. So he said to me, we'll do 6 weeks of the DSMO bladder installations and you should start to feel better. So December was the hydrodistension. I started in February of 2017 to do the bladder installations. He said to me 6 weeks and you should be better. So 6 weeks turned into 6 months and I was getting worse all the time. I was getting pain. Like before I went to see him, I never actually had pain. Then my pain was getting so severe. I told him I can't do the bladder installations anymore. I was doing them every Wednesday. I'd end up being in bed till Sunday because my pain was so excruciating. He wouldn't give me anything from pain. So I said, that's it, no more bladder installation. So he said to me, you need to go see a colleague of mine, another male doctor here in Canada. So he said, you need to go see this other doctor. And then took me like 6 months, 7 months to get into because it's a long waiting list to see specialists. He said to me, you need to go get an interstim done. That's the only thing that's going to help you because you have so many. I also had, this is the interesting thing. I had no inflammation, none of those agglomerations. I have no Hunner's lesions. I've had about 6 herpes and my bladder looks completely flawless, not even any red.
Okay. So understand here that Canada is years behind the rest of the world. And it's sad, and it has always been. So the great majority of Canadian patients that I work with come down to the US and they usually go see Dr. Ken Peters because he's just, you know, a bridge away or a ferry away from Kingston, Ontario. Right. So,
okay.
Yeah.
About a 3-hour drive.
Yeah. So the fact that your bladder's healthy is fantastic. It means it's not your bladder. It means that there's something outside of your bladder that is probably triggering your symptoms. Remember, again, getting back to Rhonda Caterinos, 20 years ago, everybody believed that IC was an incurable bladder disease. And then we have this one physical therapist coming to meetings and that Canadian researchers were at, who said, hey guys, you describe muscles so tight, they're like tight muscle strings. If we improve their muscles, they get better. Oh, cute dog.
Yeah,
what a great dog. And they walked out the first year. The second year, some barely listened to her. But then she was able to convince our National Institutes of Health to study it. And in 2008, when that research study came out, it showed that pelvic floor myofascial massage dramatically improved IC symptoms, far outperforming any other therapy. And it was at that moment that the ICU world had to go, uh-oh, maybe this isn't a bladder disease in some people. Maybe it's a muscle issue. And now we know that there are other things that can cause it. So the odds are remember, the bladder can only speak with one language: frequency, urgency, pressure, pain. Everything feels like infection. You could have a bullet wound and it would feel like infection. You could have a stab wound and it would feel like infection. That's the only way the bladder can tell you that there's a problem. But the bladder can be victimized, can become the secondary victim of other issues. And so have you had a pelvic floor assessment?
Oh God, yeah. I've had pelvic floor therapy. I've had internal pelvic
Okay,
floor.
so wait. What did they find when you did the when they did your pelvic floor assessment? What was your issue?
They said that I have pelvic, so I've been diagnosed with vulvodynia, bladder pain syndrome, interstitial cystitis, and pelvic floor dysfunction.
Okay, but tell me what they found with your muscles. Were they tight? Were they weak? Were they?
They said they were tight. They did say that I have tight pelvic floor muscles.
On the left or the right side, or both sides?
Nobody said anything. They didn't say anything. I've seen 2 specialists.
So normally when you pee, a muscle relaxes, a sphincter opens, and you pee instantaneously. I mean, like it starts within a second or two. If you can't start your urine stream right away and you're waiting 5, 10, 15, 20, 30, 40 seconds before you can release urine, that usually means that your muscles are tight. So are you still doing your pelvic floor exercises?
I was so upset with the pelvic floor therapy because I would leave there in worse pain and I would leave there with in flaring so badly
Oh.
that I just went, see ya.
Okay, okay. So this is important because if working with your muscles made your pain worse, that tells us your problem is muscular.
Okay. But then why do I flare? Like, even if I take a shower, I can't take baths anymore because I flare right away. I don't know, certain foods I find do bother me. Like, I just got out of a 3-day flare that, right now I take,
Go ahead.
I take hydromorphone for my pain. I take vaginal Valium I take the Cipralex for my mood because I got to the point where I was suicidal. I haven't been able to work at my job. I have 7 years of post-secondary education. And I haven't been able to work for 4 years.
Okay.
Because it's so bad.
Okay. Okay, hold on. I got to get out my thingy. So let us reconstruct a pelvic cavity, okay?
Okay.
Okay. So here we have a female pelvis, right? And of course, the pelvis is the center of the human body. It carries the weight of our torso because the way the body is built is the bigger the bone, the more weight it's meant to carry. So we know that the pelvis is central to carrying the weight of our torso. It also has muscles coming up from the legs in here, and it will deflect the stresses and forces from you walking, etc., stumbling, dancing, whatever. Those forces will also come directly up the muscles into the pelvic cavity. Okay. And then inside the pelvis, do you still have your uterus and your vagina and all that sort of stuff?
Oh yeah, I had an interstim too for 2 years, and I just had it removed.
Okay, hold on, but we're not going to talk about that. Okay, I'm gonna get to an important point here. Give me a moment.
Okay.
All right. So we're gonna put I'm gonna put the uterus in first. Okay. So now we have our uterus in there. We're gonna put in the bladder, which basically goes right here. Actually, do I have that backwards? I do. Okay, so here's our bladder, there's our uterus, and then we got to stick the bowel in here, right? So you can see how busy the pelvic cavity is. And of course, we also have nerves coming off of the sacrum that are going through the muscles down the legs. We have blood vessels. So there are 2 reflexes in the bladder, in the pelvic cavity, that you have to understand. The first one is called the viscerosomatic reflex. And the question behind that is, can an organ, like your bladder, change the behavior of the underlying muscles? And the answer is absolutely. Because if you're in pain, your muscles will get tight to protect you from that pain. So if you've been in pain for an extended period of time, your muscles will get tight in a guarding reflex. So if your symptoms began after chemotherapy, we know your bladder wall's fried from the chemo. We know your muscles are going to get pretty tight from the pain. Our therapeutic priority is to calm the bladder wall. As we calm the bladder wall, the muscles will release. Okay, so we know organs can change muscle behavior, but can muscles change organ behavior? Can a dysfunction of the muscles change the way the bladder is functioning? And the answer also is yes. That if you have sustained a muscle injury, that muscle is now tight, weak and tight. And so, a muscle, you think about it this way, if you hold your arm out, your muscle is long and lean and flat. If you pop a bicep, of which my biceps are very small right now, the muscle is now contracted. And you're not meant to walk around like this. That gets hard after a while because a muscle is not meant to be tight like that. Tight muscles restrict blood flow. They restrict blood flow. And so the bladder does not get the oxygenation it needs to be healthy. The vulva does not get the oxygenation it needs to be healthy. Tight muscles also make it hard to have bowel movements. They make it hard for you to pee. They make it hard for you to have sex.
Oh yeah. So
take us back 20 years ago when the UTIs first started, were you an athlete?
Avid horse rider.
Oh, okay.
And I still am. I have a horse. Well, I'm not as avid of a rider. I live on a farm. I have 4 horses here.
Okay. English or Western?
Western.
Okay. So do you?
Not a jumper, not anything.
Okay. So let's go back 20 years ago. Do you remember falling off the horse badly? Can you remember a couple of bad falls?
I fell off the horse when I was 24. So 25 years ago, I fell off my horse and I fractured my tailbone. I also have scoliosis. As well.
Okay.
And
so people, everybody watching, what did she say that we say every single time? Tailbone injuries. Girl, you have a tailbone injury.
It was bad. It was bad. I took a
right.
really bad fall. I'm lucky I didn't break my back and end up paralyzed.
Okay, that I had a tailbone injury too. That is so. You need to get this book.
I used to train horses, Christina.
Did you really?
Yeah. So
we need to add each other. We need to talk.
And hey guys,
I started riding when I was 12.
And I was a rider too.
Oh,
we did pony club. You know, English. My sister was a good rider. I was more barn crew, but I rode quite a bit too. I used to ride at our training stable. It's this great thoroughbred. Oh my God, it was so fun. But I only rode for a couple of years.
I'm a quarter horse girl.
Yeah.
Tennessee Walker.
Okay, so here you go. So here you go, girl. You need to order this immediately.
Where do I get it? I'll get it right
see if they have it on Amazon Canada. I don't know if they do. Breaking Through Chronic Pelvic Pain. By Dr. Jerome Weiss. If they don't have it, we have it, but it's going to cost a lot to send it to Canada. You can buy the PDF. You can buy the Kindle version, and the Kindle version is free on Audible. I mean, not on Audible, on Kindle Unlimited. Breaking Through Chronic Pelvic Pain.
I can't see because I can only see everybody. Breaking through.
Breaking Through Chronic Pelvic Pain.
Okay. Breaking Through Chronic Pelvic Pain.
Yeah, hon, you're an orthopedic injury patient. I bet you $100.
I get nerve blocks every few months in my back.
Okay, so I want to tell you a story that I told in our newsletter. I always say to every patient, you are an anatomical mystery to be solved. We got to understand your anatomy. We've got to understand your pelvis, right? And one of our members read my article about it, and she said, you know what? I think Jill's right. I want to have a CAT scan. They did a CAT scan. Her tailbone. So here's the tailbone, right here. You can see the tailbone curves inward. When they did the CAT scan, they found that her tailbone had healed out of place and it was crooked. So instead of being curled in, it was curled out and it was bent to the one side.
Mine curls out too.
Okay. And so what she was able to do.
At the bottom of my spine.
Okay. So what she was able to do is she worked with an orthopedic surgeon, a physical therapist, and a chiropractor. And it took a year. And by the end of the year, they were able to get her tailbone back into the correct position. And you know what? Her symptoms improved like 90%. And she was able to have a baby and she was able to live her life. She was almost bedbound before that. Listen, the tailbone injuries are huge triggers. Huge triggers.
But how come I didn't start getting these problems till 20 years later? And why do I get chronic UTIs?
Well, but you prove it. How do you know you have chronic UTIs? What's the bacteria? Do you have the lab test?
When I go and get the urine test done, it comes back with E. coli bacteria or something like I get.
Okay. Well, you estrogen atrophy, you could have some recurring issues now just because you're older and you don't have as much mucus, and you are now in, how old are you now?
49.
Okay. So you're perimenopausal. Are you still having your period?
Can I pipe in on that?
Unfortunately, every freaking month I want it to get lost.
Okay, well, you're getting there. It's going to happen in the next couple of years, most likely for you.
Oh, please, today I'm on my period right now.
So. Yeah.
I am taking estrogen. My urogynecologist wants me to take estrogen, so she's giving me the inserts.
Good.
So inserts.
Good.
So I'm finding that's not doing anything though. She tried to give me, my doctor tried to give me the cream estrogen for burning or whatever, because I have a lot of vaginal burning. She gave me Premier, and I'm a hardcore vegan, so I threw that out.
Okay, so you can get a compounded estrogen cream from a pharmacy.
So I won't use that. I have another cream right now that my urogynecologist made me. That's like a gabapentin, amitriptyline, lidocaine. I don't find any of these things do anything. The only thing that helps me a little bit is the diazepam Valium compound that I have that I insert at night.
And what does that do? But what does that do? That relaxes muscle. A Valium is a muscle relaxant.
But I don't know why. What causes like I said, when I come out of a shower or hot water touches me, like my nerves, I'm so nerve sensitive.
Yeah, but that's,
I'm automatically flaring.
But,
I don't.
Okay, but we've talked about that before. That's central sensitization. That's what happens. That's what happens if you're in pain over a long period of time, or you happen to have inherited sensitivity like I have. You know, you are a textbook case of orthopedic injury. And you're not the only horseback rider. We've worked with many, many horseback riders over the years. You sustained a trauma to your pelvis. You sustained a compression injury when you fell. And it was so bad, not only did it damage muscles, the odds are you probably bruised like heck when you fell, because when you fall, you not only do you squish the muscles, you squish the blood vessels, you squish the nerves, right? And those little nerve fibers have little tiny capillaries inside the nerve fibers that support the nerves. Those got squished. And he talks about this in the book. But the odds are, because you were a horseback rider and you fell probably several times, at least I certainly did. You probably
I fell again in 2016 as well.
Okay, so you probably have trigger points, which are in your muscles, which are long-term compression injuries, which over the long term restrict blood flow. That muscle will never be healthy as long as it has a trigger point in it, and it's interfering with the health of everything. It's interfering with the health of your muscles. It's interfering with the health of your bladder. It's interfering with everything. And so,
what about the burning? Like, I have chronic burning all the time inside my bladder, and like even outer, like in the outer, like my labia.
So we didn't talk about the second reflex. The second reflex is the somatovisceral reflex. Can muscles change organ behavior? Yes, in two ways. Number one, we have restriction of blood supply to the bladder, but number two, we have dysfunctional nerves. Because as long as those nerves,
as long as it has a trigger point in it, we talk about the second.
Here, hold on a sec. As long as you have tight trigger points that are restricting blood flow, those nerves cannot be healthy, and they start releasing substance P, which then the whole nerve sensitivity spreads from the site of the injury to the spinal cord. The other nerves at the spinal cord become involved. They all become somewhat sick, dysfunctional nerves. Thus, the nerves in the bladder will also become sick and dysfunctional. They too start to release this irritating substance P. That is the somatovisceral reflex. And so muscle injury can change organ behavior. It can deprive oxygen and it can damage nerves. And so you said, the most important thing you said to me today in this whole thing, aside from that you fell off of a horse and you had a tailbone injury, which is classic, is that physical therapy hurt. And that's actually good, because that tells us that touching your muscles makes you worse, which tells us then it's your muscle, it's a problem. The challenge is that they're working it too aggressively. And so, you know, our therapeutic priority for somebody like you who sustained a pelvic trauma is to restore blood flow. The only way we can restore blood flow is with physical therapy to get those muscles to relax. We've got to get normal muscle tone in there. And if you flared, okay, so I got to tell you the story of Sue. Sue's in our Facebook group. So Sue's just like you, diagnosed with IC, lots and lots and lots of symptoms. Every therapy helped. Nothing made sense to her. And most importantly, so all the bladder therapies failed. She goes to physical therapy. And the thing about physical therapy is it hurt every single time. She didn't get it. Why did it hurt every single time? And again, you are an anatomical mystery to be solved. She asked for imaging. And what they found was a giant piece of scar tissue woven through her pelvic floor on her left side. And that's why all the bladder therapies failed. It's because it was never her bladder. It was never that. It was actually a traumatic injury to muscles resulting in scar tissue. And they had to go in. I haven't talked to her if she's had the surgery yet. They had to go in and try to remove that specific mass. It was a benign mass. So, you know, if it walks like a duck and talks like a duck, it's a duck. Your bladder wall's healthy. You've had how many cystos? There's nothing freaking wrong with your bladder.
Right.
It's something outside of your bladder. And that is, it's got to be your muscles. That's got to be playing a much greater part in this than you realize. So I would have you get the book so that you understand. You need to be, when you're laying on your back and they are working inside of you, you have to be able to visualize what they're touching. You got to be able to say, are you working with my piriformis or my levator? Are you working with my obturator? So that you can visualize what they're doing. And it's a two-way thing. They're looking at your face to see what's hurting. And you have to tell them, okay, that's too hard, that's too little. And it's a slow and gradual process. And then another big part of this is that you've got to learn your normal muscle tone. You have got to learn your normal muscle tone. So that when you can recognize when your muscles are starting to get tight and you can do something about it. And so
they always are. Even walking up steps hurts me.
Yeah, your muscles are effed up, girl. Okay, this is the easy magic from IC Relief. Here you go. It's a wand.
I have it. I have the exact same one.
Okay, do you use it?
I don't know how.
Exactly. You don't know how. And the book will help you visualize it. But I want you to see something here. This is why these models are so important. Because if you can see that the muscles are basically directly above bony structures, right?
Mm-hmm.
And so if I were to put my finger in your vagina,
mm-hmm.
I can do this. It's a J shape. I can follow the muscle around the curve and towards the front of my body. It's a J shape. And I really didn't understand it until I read the book and it showed it to me. And then once I got this model, I really got it.
Here we go. Here it is.
Right, exactly. It's not quite the same one, but if you can, you just kind of have to, the first couple of times, try to visualize it in your brain as you're touching it. And again, you're kind of following bony structures and you're following the length of the muscle. So you can see how my fingers, so it's a, it, huh?
What do men do? How do they help men?
Same thing. They do it rectally.
Okay.
Same thing. And so we see this a lot in horseback riders, but I
get confused. Which part goes in where?
At the curve to your right. Yeah, that's what goes in. Just like this.
Well, which way? This way?
Yes,
or
that way.
Down?
No, this way. This way.
Front wise?
Well, you're gonna play. Now yes, just like that. Just like that. And you're gonna move it on both sides, because you're gonna move it this way will touch the left side, this way will touch the right side. You just don't push it up into your bladder, right? If you push it straight up like this, it's gonna push into your bladder. So you're gonna, one side, whatever side you're working on, you point it to that side. So look, see, so I've got it in here, right? And I'm just going to follow the muscle, just like that. Just like that.
Then this part is actually facing down.
No, it's not. It's not facing down. It's actually facing up. You work with your physical therapist so she can train you. I shouldn't be training you over the internet. But
I'll start over with her again because I haven't seen her in like a year because I get so discouraged because I'm like, I don't know why I'm always flaring. Why am I always having pain? Why do I have pain all the time after I eat?
But yeah, I know, but we know why, because of the viscerosomatic reflex or somatovisceral reflex.
Like my pelvic pain is crazy too.
I know, but you also are getting to the point where you're going to be dealing with estrogen atrophy. It is what it is. But, you know, listen, if it walks like a duck and talks like a duck, it's a duck. This all began for you with a tailbone injury, which is exactly what we see now. Now that we know to ask about tailbone injuries, it's stunning the number of patients who have tailbone injuries. I wish I could, you know, have people raise your hand if you had a tailbone injury. It's a huge population of patients who have original orthopedic injuries. And remember, we had this big research study that showed that men with testicular pain had an underlying hip issue, that an orthopedic issue can cause genital pain and bladder pain and pelvic pain. Okay, so the good news here is that your bladder's healthy. So it doesn't make sense to do bladder therapy so much.
But when they did do a urodynamics test, I can't hold much. I can't hold what a normal person can in my bladder.
Well, I can't either.
Yeah, I can't either. Like, I think he said 550 milliliters was before I should start to feel something. At like 200, I was going to pee myself.
Me too.
My bladder.
That's where I was at about 250. But again, how can the nerves be healthy if they've been injured and traumatized? Mm-hmm. I mean, so the point here is that your bladder wall itself is perfectly healthy. It looks like a baby bladder, just like mine does. There's nothing wrong with my bladder. It's my pelvic floor. I have an injury on my left side. That's where my dominant issue is, along with the scoliosis, which has created long-term kind of imbalance in those muscles. So, you know, again, I'm not a doctor. I can't give you medical advice. My job is to open doors. I am opening this door widely and saying, go pursue that and tell her you had a tailbone injury and ask her to share what's hurting when she does it. Try to think about the anatomy a little bit more clearly here, because this is what we know. A vaginal Valium suppository, which relaxes muscle, is the only thing that helps you. You said it. That's exactly what you said.
It helps me in the nighttime, yeah. But then again, I'm taking the Cipralex and I take Zoflocone to sleep, so I'm knocked out.
Well,
but by the time I wake up in the morning, my bladder, like the pain I have, is so severe because I haven't been to the bathroom for 8 hours.
Yeah. Well, if your bladder is meant to have 28 units of blood and it's only getting 10 units of blood because of tight muscles, is it hard for your bladder to be? Can your bladder be fully healthy? And the answer is no. Mm-hmm. So we have to, and typically for these patients, basically what happens is you suffer an injury. You have no idea you have an injury. Your first symptom is frequency, urgency. You call the doctor say, hey, I've got a bladder infection. The doctor throws antibiotics at you. You might feel a little bit better, but it happens over and over and over again. And finally, the doctor says, hey, I'm not growing bacteria out of your urine anymore. I think you've got overactive bladder. They give you overactive bladder meds. They don't work. Eventually, you go back. The doctor says, hey, I think you have IC. I'm really sorry. It's this horrible thing. It's incurable. Here's some Elmeron. Here's a diet. And you could be on Elmeron for 20 years and you would never get better. Bladder therapies would never help you because your underlying problem is not your bladder. Your underlying problem is, in fact, poor blood supply from dysfunctional muscles. And remember, the 2008 study found that pelvic floor physical therapy outperformed bladder therapies like 2 to 1.
How long does it take?
A long time, because your muscles have been screwed up for 20 years. It's not going to get fixed in 4 appointments. That's going to help you understand the landscape, but you're an athlete. You're an athlete. You can do this. This is about trying.
I'm not an athlete, trust me.
You were, though, because you were a horseback rider.
I pleasure rode, yeah, but I mean, I wasn't like.
I know, but you understand the concept of a workout. That workout, you don't become a professional from 4 workouts. Your muscles, I would bet you, have been tight for years. And so now you've got to learn what's triggering the tension And we got to get those muscles, we got to change the muscle memory and get those muscles relaxed and flat again. You're stuck here instead of here.
I know, I can feel it all the time. I always feel clenched.
Exactly. Exactly.
Well, what is it then that causes the pain when I walk upstairs?
It's your muscles. Anytime you have pain moving, it's your muscles. Girl, go get your muscles checked. Okay?
All right, I'll go back to her and
but you got to read the book.
I think I'm going to order it. I'm going to order it. I think with COVID now, she's not open, so I don't know.
Well, but
okay. How often do you recommend going to get pelvic floor therapy?
I think you're probably going to need once a week therapy for 3 to 4 months. And
is once a week enough? Because it doesn't seem like
well, it depends upon what they find. And I would want to know what's going on with your tailbone. I would want to know if your tailbone's out of position and stuff like that too. But I that's where, if I were you, I'd be spending my money is on muscle work and trying to figure out if the bones have healed correctly or not. Okay. So this is good news. This is good news.
Yeah, but I've tried pelvic physio, I guess, before, and I gave up. So
I know you did. A lot of patients do.
I also find it very uncomfortable, and I'm sure other women do too. It's a mindset too. I get very uncomfortable having a woman putting her fingers inside me, and it's so. I just.
But the only way to reach these muscles is with a finger inside of you. That's the only way to reach them. There's no way. There's with the TheraWand or this one, the IC Relief one. Okay, so you had the tools. You just didn't understand the importance of the tools. But as I always say, listen, if physical therapy,
that's where the burning comes from too, or could any of that be diet?
No. Muscles that are working hard produce lactic acid that burns. Do you remember when you were a kid and at school and they'd make you run around the track and eventually your leg muscles would start burning?
Yeah.
That's what happens. Muscles that are working hard produce lactic acid. That causes a burning sensation. So that vaginal burning, feeling like there's something stuck up there, a foreign object in your vagina or in your urethra, feeling of something's falling out of you, something's being pushed up inside of you. That's all muscle, hun. Yeah, that's all muscle. So I'm very hopeful for you. So you keep in touch.
I'll go back to her.
And we're just going to put you and Beth and Sue in our group of horseback riders who had pretty big falls. And we see that history. Okay.
But the diet thing I should be careful with as well.
Well, yeah, because you're older, you're not going to have as much mucus. So yeah, I mean, why wind up the nerves? Your nerves are already wound up. You certainly shouldn't be doing caffeine of any type. And
I don't drink coffee.
Okay. Or green tea or black tea or chocolate. Let's lose the things which are neurostimulatory.
Yeah, and anything acidic like tomatoes, vinegar, all that stuff.
Yeah, and so again, the Bladder Builder would be very interesting to try, or the Peora would be very interesting to try, just to try to calm nerves down. Okay.
I did try the Cisco stuff, I remember, a long time ago, and it didn't work, didn't do anything for me.
Well, and again, if bladder therapies fail over time, and again, your bladder wall's healthy other than estrogen atrophy at this point in time, and maybe a little bit of nerve irritation, the thing that would be the most helpful for you would be something that's going to relax muscles, like the vaginal Valium suppositories that you're using. Okay?
All right.
Okay.
Thank you so much.
So I want to say, when Chris Payne created his subtyping system, one of the things he said is how unfair it was to tell patients this was incurable. Because I hear
that all the time.
Okay, but some of these subtypes are curable. And the pelvic floor muscle is curable. If we can get those muscles to behave normally, that could be cured. And so carry hope in your heart, okay?
Okay, I will. Thank you.
Okay, nice talking with you. And to people listening on Facebook and YouTube, those were two really, really interesting patient stories, right? And sometimes you have to go back to the very beginning. Was there trauma? And it's amazing the number of patients that I work with where we can go back and we can find that triggering event. And usually it's a traumatic injury to the pelvis, and usually it's a tailbone injury. There you go. All right, hon. Nice talking with you. Okay. I've got Shanna, I've got R. Padley, and I've got Eric. Eric, you came in last, I think. So if you don't mind holding tight, I'm going to go to R. Pavley, but I don't see a microphone or card for R. Pavley. R. Pavley, can you turn on a mic or a camera? RP? Okay, Shanna, let's try you. Shanna, can you hear me? Yeah, Shanna also is not showing audio. She's only showing a camera. So maybe they're just watching. So Shanna, if you can turn on a mic, that would be great. If you don't want to do it, that's fine. Christina, I'm going to mute you. I'm letting Faye into the room. All right. All right. Sir Eric the Great, how are you doing today? Turn your mic on.
Okay. How's that?
Hey.
Great. It's nice to see all of you. You ladies, I have to say, I know so much about vaginas and all sorts of things. Please don't feel uncomfortable. I've done everything but I've spent so much time doing pelvic therapy and work with female therapists that I'm compassionate, comfortable, and I have a great big heart for all of you. I've been dealing with pelvic floor stuff since about 2007 and going down a big path. In fact, Lord of the Rings is shorter than this whole experience. So, and that's the extended version. So
what was your triggering event?
Well, here was my triggering event. I woke up one morning and I had to pee constantly. And I was like, why am I peeing so much? So I went to an emergency room and that started a whole, and they couldn't find anything. Weird thing is they didn't touch my blood sugar. And I think that was what was actually going on. But that started a whole amping up of going into urologists. I've had urodynamics. Anthony Schaefer did my cystoscopy, which was no fun. I've seen Stephanie Prendergast. I've been to Rhonda Caterino's office. I've talked to Amy Stein on the phone.
There you go. Like the best of the best.
When I meet Jill in a non-COVID world, I'm going to give her a big hug because she's amazing. But yeah, I've been to everybody. I have a whole library of pelvic pain books. I've talked to Headache in the Pelvis, Wise guy.
Yeah.
And I've been down that path. And finally this last year, I was starting to be able to put all the pieces together. And the thing, when I was hearing Christina talk, my heart was feeling so compassionate for her because I know what it's like to want to know what's going on. Why is this? And I had all those things because you're asking all the specific questions. Why does it hurt when I walk upstairs? When I take a shower? And one of the things that I started to learn about in the last year was the whole central sensitization thing.
Yeah.
And for me, and I want to, Jill, I know I'm supposed to email you these, but this is the book that I got turned on to, Why Pelvic Pain Hurts.
Oh, I have it. Yeah.
And it's amazing. And then the complementary book, Why Do I Hurt?
Yeah.
And then the Why Do I Hurt workbook. And these were really good because these all went into the neuroscience of pain and also connected them to the world of pelvic pain. And what I learned is that for me, like same thing, my bladder isn't fine, but I carried a lot and still do carried a lot of weight. So when you're carrying a lot of weight for many, many, many years, your body is compensating and going, hey, we're not supposed to have this much weight on our pelvic area. This isn't normal. If I would strap an extra 150 pounds on any one of you right now, you go, oh my gosh, this is horrible. But as you gradually move into it, your body goes, hey, we're adjusting. We're not supposed to do this, but hey, can you do this? Can you do that? Can you adjust? So what happened is that my body became acclimated to all this. And then coupled with changes in hormones and depression and stuff like that, what helps me is SSRIs, antidepressants, because that calms my nervous system.
Right.
So I started working with a woman this year who used to be at the Mayo Clinic. Her name is Laura Mehofer. Best person. She's a holistic pelvic floor therapist. She does manual stuff, but like she told me, she says, if people are expecting to come in and get a 45 or an hour treatment once a week and get better, she says, that's not how it works.
Mm-hmm.
She says, I can do my part, but then you have a big part to do. So what I did is I developed a toolbox. And inside here, I have all my tools that remind me to, and little chapters and stuff. And it reminds me, for me, I needed to walk. She gave me some stretches, 4 stretches in the hip flexors and stuff like that. I got a yoga strap. Good eating, good rest, all the things that we know. I mean, the things that go into helping get our equilibrium and our nervous system back in balance.
Right.
And when I was talking to Jill this year, I was like, I felt like I was in the worst shape I'd ever been. And I'm like, Jill, why? And she's like, you need to find an answer. I haven't tried to find Dr. Weiss's phone number and call him up and talk to him and say, hey, I know you're retired, but you must have an answer for me. We are also desperately looking for answers. And that's not wrong. But it takes someone, it's not a single thing. It's putting the whole thing together for each of us. For me, I know that my body, so, and Jill and Laura, she said, and I want you to walk. She said, you need to walk. I also learned, I'll tell you one story that'll help bring things together. Years ago, many years ago, I was losing my job. And the weirdest thing happened. My hands started to have problems. It would hurt when I'd open a doorknob. Pretty soon I was researching, like, this, losing, I was getting convinced that I was going to lose use of my hands. There's nothing wrong with them. I went to a doctor at the University of Minnesota and I said, what's going on? And she did some, tests and stuff. Then she said to me, she goes, what's going on in your life? I go, oh, it's horrible. I'm losing my job. This is awful. My life's ending. I'll never find another job, She said to me, there's nothing wrong with you. She said, basically your nervous system you've got somatization. Physical symptoms have manifested in your body because of stress.
Yes.
And when all that resolved? Yeah, go ahead, Jill. You were say something?
No, I was just going to say that's nervous system windup, central nervous system windup.
Exactly.
Right?
No.
Okay. For me, it was like, it's called somatization, where physical symptoms manifest as a result of stress. I had cortisone shots, everything, nothing helped. And you know what happened when all that resolved itself? I've never had a problem with my hands since.
Right.
But I also haven't been doing anything now with my pelvis, because and I tend to carry more abdominal weight. And I don't know if you guys have been pregnant, but you know how it is when that pelvis is being stressed when you're pregnant. This is not normal. Well, my body just started to adjust. Plus, over the years, because of unhealthy habits, I developed diabetes. So I guarantee you that what was happening that day when I was at the hospital, I bet I just had high blood sugar. But I started to research, and I learned things about, I learned about interstitial cystitis, and I wandered into the world of Pudendal Neuralgia. I'm like, oh my gosh. And I would have times when my nervous system was really heightened, bowel movements, and my system would flare like crazy. I would get aching in my penis and stuff like that. What the heck is going on? And you know what? When my nervous system starts to get back in order, my body, when I start to treat myself better, you know what? You don't hear me talk about it. And the hardest thing has been, and I went to a clinic in Rochester for pain rehabilitation. I went there with pelvic stuff, explained everything. I thought, they're probably not going to want me. They're like, no, you're the perfect candidate. I went there for 3 weeks. And we didn't talk about it. We stretched. We learned about sleep. It was an amazing program. And so now I feel like I know what's going on with me. I don't have to have a cystoscopy or urodynamics. For some of you, this might make sense, but I would measure my urine religiously at times. I would steal those little things from the doctor's office, and I would go, oh my gosh, 6.5 ounces. What's going on? I didn't void 8. I only voided 6.5. Oh my gosh, I voided 4. And it made me, I don't want to say it made me a nut, but I think in this group, you understand what I'm saying. I became obsessed about it.
Right.
Obsess about something, if we obsess about anything, we become so hypersensitively focused on it. And it's because of all the people I worked with, and Jill especially. These online support groups are amazing. And I feel like I need to tell people, like, there's hope. And like for you, Christina, I know you're feeling so much, and I'm just like, I know what it's like to find a pelvic floor therapist, and you're going, this is not working. You're in Canada, right? Okay. Yeah. So pelvic floor therapists are all over the map, but finding one who is a holistic good, and if you're like, well, have the cash, you find someone that can help you. Your life and body is worth it, but there is hope. There with your gentle dog and your fireplace. Those are great relaxation things, except for you pushing the dog away.
Okay, so I want to explain it in a slightly different way, Eric, because I think this is important for people to know. Yeah. So there are a group of patients who get multiple pain conditions. right? And so, and a perfect example is it starts with somebody. I'm going to give a woman as an example. But I should do a man as an example too. A woman who has painful periods in her 20s. She's diagnosed with endometriosis. Then years later, a couple years later, she's got bowel issues. Then a couple years later, she's got urinary issues. Then a couple years later, she's got fibromyalgia. And a couple of years later, whatever. Okay. So the question is what is driving that expansion of the pain to different parts of the body? And that was the entire theme of the International Pelvic Pain Conference that I attended in October. And that's why you have to get our magazine for everybody who has this. Okay, so this is the issue we just issued. This is the issue we just released over New Year's. And it's 15 best, it's literally the longest, best article I've ever written in my life, in my opinion. So what happens? So the part of the class that was most interesting to me was the pediatric risk factor class, because often this begins at a young age. Like for me, it began in 7th grade. So what they found is that the year before, somehow in the year before this all began, that child suffered a physical traumatic injury, breaking a leg, falling on their butt. There is a major trauma of some type. And neurologically, let's think about what that does for a moment. So here you're a kid and it hurts badly, and you get scared. And then they take you to a doctor's office or a hospital. That's scary. So now we've got the pain of the injury. And if it's a long-term injury, we're talking pain for 2 to 3 months as the bone heals. Then you're forcing them to go to a doctor or a hospital or have a treatment or have a cast. That's scary. That's painful. Then they have to figure out how to go to school with a cast. That's embarrassing. That's painful. And what we've got is the start of central nervous system windup. That patient is now in fight or flight. Your brain's job is to protect you. Your brain's job is to save your life. And when you're scared, your brain's going, what the hell? What's going on? What's going on? It's the sympathetic nervous system turns on. If you open the door and you see a saber-tooth tiger, you're going to jump back. You're going to slam the door shut. But what's happening at your brain and in your central nervous system is your sympathetic nervous system takes over, your amygdala turns on, your heart rate increases, your blood pressure increases, your muscles get tight, your blood sugar changes. And this is all part of your brain's attempt to save your life. And then normally, the stressor goes away and the parasympathetic nervous system takes over, which reduces your heart rate, reduces your blood pressure, relaxes your nerves, relaxes your muscles, restores normal blood glucose, right? But what we see is that patient in fight or flight for an extended period of time. And it's kind of like muscle memory, only it's brain memory. Because the other thing that happens with your brain is always establishing context. It's like for me, like my jaw's hurting. I have a little TMJ right here, right? Like right here. That hurts when I push that right there. But it started when I bit on something. It was like 3 days ago. And so it's like, okay, is it my tooth? Is it my tooth? Is it my tooth? I was like in the shower going, oh my God, it's my tooth. And okay, I have a root canal. Did I break the root canal? And you end up in this windup. And you really have to work hard to get yourself to stop doing that, because that doesn't help. Yeah, go ahead.
So can I ask you a question? So let me ask you a question. If you spent 24/7 researching that, thinking about it, obsessing about it, what would start to happen to that pain? All you did was focus on that.
It would intensify.
Right.
Absolutely. Absolutely. And
you're building the neural pathways in the brain, right?
Huh?
You're building the neural pathways in the brain for for like more, right?
No, it's contextual in the midbrain. When a pain message goes up the spinal cord, it goes to three portions of the brain: the low brain, the midbrain, and the upper brain. The low brain is the gate. It only lets the most important pain message through. The midbrain is context. The midbrain, the purpose of the midbrain is to look at your memories, look at everything else, and look at your state of mind to try to figure out if this is serious pain. Pain that is accompanied by anxiety will be intensified by the midbrain because your midbrain thinks your life is at stake. Pain that is accompanied by laughter will be minimized by the midbrain because the brain goes, well, she's laughing. Obviously, your life's not at stake. And so you end up with this fight or flight, constant fight or flight, massive levels of adrenaline floating through your bloodstream. The anxiety is off the chart. The catastrophic thinking is off the chart, but it's all being driven by what they call maladaptive nerves. This is not a mental illness. This is a nervous system that is stuck. The amygdala is staying on instead of turning itself off. And the therapy is, they call it physical therapy for the central nervous system, is we've got to get the brain to turn off. We've got to turn off the amygdala, turn on the parasympathetic nervous system to calm everything down. And if you go to my lecture, my meeting 2 weeks ago, I did a much better job of explaining it in the first hour. But this is the connection. Now we know the patients with chronic overlapping pain conditions, when we look at the brain scans, they're stuck in fight or flight. They're absolutely stuck in fight or flight. And this is true in the IC patient population, and this is true for patients with chronic pain syndrome. What's the right word? The Chronic Research Alliance, the Chronic Pain Research Alliance, which is a combination of the fiber group, the endo group, the IC groups do not participate in that, unfortunately. The TMJ group, they all got together and they've been studying this for years. And it ultimately all comes down to a brain that is stuck in fight or flight. The best way I can explain this is this way, because the other thing that sets the foundation for this is bullying or abuse. And so me too. Wow. Right. Okay. So what happens to the central nervous system in that point? And I think the best way to think about it is to think about a new puppy. So you have a new puppy that comes into your home. It's all happy, squirmy, tails wagging. But what you don't know is there's somebody in the house who kicks it. It doesn't, and it could be a child, just somebody who just doesn't get it. And that puppy on the first day is so happy. And then when nobody's looking, it gets kicked. And the puppy's like going, what the hell? What? Ow? Why did that happen? But, the puppy's pretty happy. Next day it comes along. It's really happy, going to all the family members, goes into a room, gets kicked again hard. And the puppy gets kicked every day. Well, in 2 weeks, that puppy's not going to be happy anymore. That puppy is going to be living in fear. And that puppy is going to walk into that room looking for the abuser, with his tail between his legs, and the family members are going, what's wrong with Jackie? And what they don't know is that this puppy is being abused every day. Thus, this puppy every single day is stuck in fight or flight. They can't get out of it. And it becomes habitual. And the same is true for somebody who is abused, or it doesn't matter age. If you're an adult and you're at work and you have a bully at work, every time you walk into that office, you are walking in fight or flight. Your brain is thinking you're facing a saber-tooth tiger every single day, and it's preparing to fight for a saber-tooth tiger. And the tragedy of life today is we have a lot of stressors. And now we got COVID, right? And now we've got, riots and crazy stuff happening. But let's talk about the bullying for the moment. I was bullied in elementary school, big time, by a murderer. He later raped and murdered my neighbor. I've talked about this. And for 3 years, Like nobody would walk with me because home from school back when we walked home because he would be throwing rocks at me. I understand why kids wouldn't walk with me. They didn't want to get hit by a rock. But he was much more evil than that. And he raped and murdered my neighbor, like 5 years later. He was evil. And the trauma that took on my body is still felt today. I am not normal in that sense going through that trauma. And I have not been, it's been very hard for me to trust men. And it just is what it is. That's what happened to me. So did that create a contextual? So I was living in fight or flight in elementary school, 4th, 5th, 6th grade, even 7th grade, even though he wasn't at that school, his friends were at that school. I can still remember in high school, one of his friends chasing me, but again, nobody's saying this is a mental illness. What they're saying is that we have a brain that's stuck in fight or flight. And the way to do that, the way to heal that is with your senses. Because your brain, if you look at the brain scans, it's like little thunderstorms, like poof, 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 all over the place. And when you're under stress, it's poof, 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 it's all over the place. So we have to get the brain's attention to break it out of that stress response. And we do that, number one, with puzzles. We can do that with meditation and things like that. But the most important thing is to use your senses. And so, and I go through this because I took everything from the course that I could find and I put it in here. So there's something called I Spy. I Spy engages all of your senses in your brain. And when you engage your brain with your senses, you're forcing it to turn off. You're forcing the sympathetic nervous system to turn off. So let's do I Spy, guys. Let's just do I Spy. Okay, so the first thing I want you to do is just look around your room and pick something to look at that is pretty. Do I have a spot right there? Look at that, I do. So I have a new calendar with a blue butterfly on it. Okay, so just look at something that you like. Take a nice, slow, deep breath. There you go. In for 3, out for 3. Okay. Now, what do you smell? Can you smell anything right now? Christina, you have a fire behind you. Can you smell the fire? Okay. In, out. Okay, what do you hear? I can hear. Okay, you hear the fire. I can hear my elderly parents talking in the kitchen. My dad. Okay, in, out. What do you taste? Can anybody taste anything? Like for me, I can taste.
Oat milk, warm oat milk, so I taste it.
And for me, it's mint tea. Okay, so focus on.
Rama.
There you go. Okay, in, out. Now I want you to touch something with your fingers. Touch something with your fingers. You know what? I'm gonna touch these muscles. I'm touching pelvic floor muscles. It's kind of a rough texture, right? It's interesting. You'd think it'd be smooth, but it's actually, you can feel the muscle fibers. Okay, in, out. Okay, now the second half of this is the fun half of this. Now, imagine looking at something that will always bring a smile to your face. What could you look at that would make you smile? And for me, it would be an animal, a cat. Okay, in, out. Now, what would you hear? Imagine hearing something that would put a smile on your face. What would it be? A child's laughter? A song? John Denver? I always smile when I listen to John Denver or BTS. I love them. Okay, in, out. What could you smell? Imagine smelling something that would put a smile on your face. What would that be? You'd be my cat. Or hot cinnamon rolls. Okay, in. Out. What could you taste? Imagine tasting something that would put a smile on your face. What would it be? I know it would be, for me, it would be a Frappuccino, which I can't drink right now. Love Frappuccinos with whipped cream on top. Okay, in. Out. And what could you touch? What could you touch that would put a smile on your face? What would that be? Beth, I think you're already doing it. Your dog, right? Okay, in, out. And you know, it's interesting how much calmer you get when you do that, because you are turning your amygdala off, you are turning your sympathetic nervous system off, and you are turning on the parasympathetic nervous system that calms everything down. So when you force your brain to pay attention to your senses, it does the job. Mind, body, and this is mind-body medicine. And mind-body medicine has a terrible rap. But when you understand it within context, that all we're trying to do is calm the brain down and the central nervous system down, it makes total sense here. So what happens is a lot of IC patients, because you're in pelvic pain, man, you're just focusing on your bladder. And you can't do that. You got to focus on calming your nervous system down too. And that's why mind-body medicine and paying attention to anxiety and doing some anxiety techniques, et cetera, is just central to every good pain management program, and it is central to us, right?
Jill, if I can add one thing.
Yeah, please
I
do.
have a lot more to add, but one thing, I had the most wonderful pelvic floor therapist in Chicago. Her name was Maureen Blanchfield O'Keefe, and she worked in Grana Catarinas' office. And she said one thing to me, and it stuck with me to this day. And I hope it means as much to you, but she said to me that the body is designed to heal.
Yes.
And that I have glommed onto that so many times when I have felt like, oh my gosh, this is worse, or this now, and sometimes when I've sort of quote unquote relapsed, it's been the worst time than other times before. And I come back to when I hear her voice in my head, she says, the body is designed to heal. And I think that's so important to remember, because that should tell you that your body is designed to work in a way to heal. And that's our nervous system, everything, which means that there's not a lack of hope.
We just get in the way. Healing is always happening. Healing is always happening. It never turns off. One of the challenges is that we just get in the way. And you know, our bodies were designed for life 5,000 years ago. You know, when there was the occasional saber-tooth tiger once a month, you know, but today we have saber-tooth tigers every minute of every day, pretty much. Mm-hmm. We're all being bombarded by stress. We're all being bombarded by things that trigger fight or flight. You know, you might not feel it, but that's what's happening. And it's when when you get stuck there and you're living in anxiety, it's hard to break out of it, but it's possible. Again, I did a much better job talking about it 2 weeks ago. So anybody who's interested, go back to the video from 2 weeks ago. All right. I think unless Shanna wants to say anything, Shanna, our Pavli does not have audio or video connected. Shanna doesn't either. So we're going to shut down the Zoom. You guys, thank you so much. You are, and remember, you know, context matters here. You don't have cancer. You're not bleeding profusely. What we have instead are kind of chronic physical injuries, and like Eric just said, your body is designed to heal. We got to create an environment that will support healing, and that's physically with what we're doing and what we're eating and how we're moving and how we're working with those muscles. But that also is about, you know, emotionally too, and making sure that the stress isn't out of control and the anxiety isn't out of control. And it's doable. I always think about Why did I get better soon? Because remember, I had a doctor tell me when I was 33, you will forever be in severe pain. This is your life. Get used to it. And that was the moment I started fighting back. And I said, I'll prove you wrong, you son of a bitch. How dare you say that to me? And that was the day I started learning and reading and all of that sort of stuff. But you know, the second thing that I did within a year is I took an anxiety management class. And I took, I got into Norma Vincent Peale, Power of Positive Thinking. And I think of everything that I've done, aside from pelvic floor work, it was that made the biggest difference. Was taking the anxiety management. I can recognize it now. I don't stew in it. Although it's harder now with COVID, but I don't stew in it like I used to. And I calm my central nervous system down. And I think that's why I don't have the other issues like I used to. So anyway, all right, you guys, thank you for joining us and telling your story. Ed, Eric, thank you so much for all of your wisdom and your advice. Christina, Beth, ladies, let us talk. We will talk further, okay? I can't wait to hear what they say about your muscles.
Okay.
Okay? All right, guys.
Thank you.
All right. Zoom is off. And now I am coming back to, no, I'm not going to update software. No, thank you. All right. Now I am back to Facebook and YouTube. Jessica says, thanks so much. I recently found the IC network, and for the first time in a long time, I had hope. Thanks for your job, Jill. Saludes desde Mexico. Thank you. Pavan asks, do you have to have an internal exam for pelvic floor? Absolutely. Absolutely, you do. All right, here, hold on. My hair's getting all weird. Ugh. I need a haircut, but I'm not going. Well, all the hair salons are closed. Hold on. Okay. There we go. All righty. Lorenza says, thank you. Tara says, love this. Thank you for the info. Mary says, is ketamine for depression treatments irritating to the bladder? It could be in quantity. It could be in quantity. You got to be on top of it. You know, a little ketamine goes a long way, but ketamine is also well known to act kind of as an industrial solvent on the bladder. I have a website called the ketamine, I think it's Ketamine Cystitis Network. Let me look here. So we're the only group that also does ketamine support. Ketamine is also a recreational drug that replaced heroin about 10 years ago because it was much cheaper. So when you use ketamine, you feel like you're floating in place. I think it's ketaminecystitis.org. Is that it? Yeah, that's it. Ketaminecystitis.org. That's my website. I haven't updated that recently, obviously, like in 9 months. So the problem is that when you do ketamine, it basically starts dissolving tissue, and it causes damage throughout the body. It does a lot of damage to the kidneys, a lot of damage to the ureters, and a lot of damage to the bladder. And the funny thing is that ketamine is not addictive. It is not physically addictive, but it is emotionally addictive. And so, you know, it's an issue. Felice says, what do I think about Elmeron? I think Elmeron is done as a therapy because of the eye issue. And we're not suggesting it to anybody anymore. It's the only oral FDA approved medication in the United States. But now that we know it's linked to blindness, it's just impossible to recommend it to anybody, in my opinion, or to even suggest it. Lorenza says, what about cannabis for IC? I'm all for it. I'm all for it. The IC Network did a 10-year study on medical marijuana and IC. I published that data years ago. IC patients generally prefer comestibles, edibles, rather than smoking, because the smoking does more byproducts that can irritate your bladder. My suggestion, if you want to try CBD, is that, and we sell hemp CBD in our store. I like the hemp creams. I use hemp creams all the time myself. For medical marijuana, though, you have to make sure that that the company is doing safety testing And you should be able to look at chemical test results on their website to prove that their product is not contaminated with pesticides. There's a very interesting case here in Southern California several years ago of a guy who had like a serious back injury, and he had relied very successfully on medical marijuana. And then his latest, and he was getting it at a dispensary, and he had a card, and obviously it was legal. He started getting sick, and he started feeling like he was being poisoned. So he sent it off to a lab, and it was massively contaminated with pesticides. So he took it to a TV network down in Los Angeles, and they did their own study. They bought medical marijuana from a whole bunch of different dispensaries, a whole bunch of different brands, even organics, and the vast majority of them were massively contaminated with pesticides. There were only a few who weren't. So look for those pesticide results. And if they don't have it, don't buy it. Shannon says she believes that childhood adverse event. Yeah, we just got a brand new study on that. We have known now for, I'm going to say 15 years, we've had research that has showed that a number of IC patients have had an adverse child experience, whether it is a physical trauma or abuse or something like that. Mary says, can growing up with a lot of tension in life cause IC? It's not going to cause IC. It's going to cause central nervous system windup. That's what it's going to cause. Mary also says she had physical therapy over a year with comfort. Good. And Mary says, I have hip pain. I can sometimes get 900 ml accumulating in my bladder. My bladder capacity is good. I have Hunner's lesions. Because of my hips, I can only walk a very short way. I have to stop walking. Yeah, that's tricky, because if you've got an underlying orthopedic abnormality, it's going to mess with your muscles and potentially trigger more discomfort. Susie says, I try to remind people with IC to first evaluate the lower back, the pelvis, the pelvic floor. It's not always the bladder. Exactly. I hate hearing people going through unnecessary treatments. Exactly. I so trust pelvic physical therapy, chiropractor, integrative, and practitioners for hormones. And you go back in time, like Diane Manhattan, who helped me start the IC network years ago. I mean, she had a hysterectomy when she was like 22. Never had to have the hysterectomy. There are a lot of patients who had inappropriate hysterectomies. It's sad. And appendectomies and other things like that, because they literally didn't know how to look beyond the bladder. And that's where Western medicine fails a pelvic pain patient, because doctors like to stay in their box, right? Urologists like to stay in the urinary tract. Gynecologists like to stay in the reproductive tract. Gastroenterologists like to stay in the bowel. And they don't necessarily understand interrelationships, especially interrelationships with muscles and nerves and blood vessels. My physical therapist told me I should be stopping my treatments. Then COVID came and I get none now. Yeah, COVID's rough. David says, I would like to buy the book, Breaking Through Chronic Pelvic Pain for Someone. You choose. Oh, David. That's very cool, David. All right. All right, guys. So David in our Facebook chat would like to gift somebody with the book, Breaking Through Chronic Pelvic Pain. So, David, we have to figure out how to do it. How should we pick somebody? Any ideas? I try. Okay. So, email me if you're interested in getting the free book that David would like to give you, a new book of Breaking Through Chronic Pelvic Pain. Email me icnetwork@mac.com. And I want you to tell me, I need your mailing address, but I also, you gotta work for it a little bit. So I want you to, I know if you've suffered a traumatic event, like a fall or something like that, tell me about the trauma that you think might have created the foundation for this. And if David's going to throw a book in, I will throw a book in. So we will give 2 books out. Okay. So if you're interested in getting the book, Breaking Through Chronic Pelvic Pain, email me, icnetwork@mac.com. And I want you to tell me the trauma that you think might have triggered your pelvic floor issues. And David said, whoever needs it and maybe can't afford it. Yeah, same too. And so if money's in it, you know, also you can tell us if money is an issue too. David, you're a gem. Thank you so much. Thank you so much. Felice says, some psychologists think it is a result of psychological trauma, for example, after I cheated. I think that that's very cruel and unfair to say that. I think that physical trauma is real. Physical injury is real. The bladder can be injured. The muscles can be injured. The nervous system can be injured. But we also know that long-term accumulated stress and anxiety potentially can also do some injury through excessive levels of adrenaline, et cetera, et cetera. But I mean, the psychological trauma isn't going to damage your bladder directly, but it's going to make you tighten your muscles. So maybe that's triggered some pelvic floor. And over time, if you're in central nervous system windup, then maybe your nerves are more sensitive to your bladder. That's a possibility too. Julie says, is Peridium better than Urabel? You know, I don't know. You just kind of, Peridium is really not meant to be taken more than, a couple of days at a time. Whereas Urabel, I think is meant to be taken a little bit longer. I might be wrong. Look at the label. Deb says, I started Bladder Builder just before Christmas at the dosage, dropped to 1 a day. Oh yeah, I read that. She is now symptom-free. Good to hear it. Elizabeth wants to give one too. Wait. Elizabeth wants to give a book too. All right. So now 3 people can get 3 books if you email me, icnetwork@mac.com. icnetwork@mac.com. Email me your snail mail address as well as what you think, what kind of physical trauma or trauma you think you took to your pelvis that might have triggered your muscle tension. And David and Elizabeth, if you guys can just go on over to the website. Actually, you know what? If you call me or email me on Tuesday, you know what? I'll just have you pay the cost of the book rather than the retail price. Okay. There's no reason for me to take money off of that one. So call me and then we'll do it a different way. Okay. I might even just take 2 books out of inventory and I'll give you a figure and then you can just make a donation in that amount. But anyway, call me on Tuesday. All righty. All right, you guys, listen, we've been going for 3.5 hours. I think it's time to stop. I got to get up and move you know what I figured out yesterday? Y'all know that a month ago, I ruptured 2 discs in my back. Like, really? What else can happen? And I was at the store yesterday, and there was a guy walking up without a mask. And so I tried to sprint around him. And I can't hop on my right leg right now. I'm like I can hop on my left leg, right? I think I can, right? But, oh, no. Oh, let's hope the nerve injury goes away. This is bad. I need to be able to go up and down stairs, for God's sake. Tara says, I'm new to this group. Thoughts on gabapentin or duloxetine? I'm on both for pudendal neuralgia, but I want to get off. Well, with pudendal neuralgia, Tara, number one, we got to figure out where the nerve is being compressed. Generally, the most important therapy for pudendal neuralgia, and again, this fabulous book goes into pudendal neuralgia, and he actually believes that a lot more patients have pudendal neuralgia, nerve injuries, than they realize. We have to address the stricture where that nerve is being compressed, and we have to calm the nerves down. And so generally it would be physical therapy combined potentially with something like gabapentin. But he talks about something that nobody else has really talked about. And that is that sometimes the nerves are injured in the subcutaneous tissue right underneath the skin. So he looks at the skin and he looked at the subcutaneous tissue under the skin. And for those patients who had pain with touch, he would do like a topical lidocaine on the skin to calm the nerve. But he also did subcutaneous injections of lidocaine to calm the nerves in the subcutaneous area directly underneath the skin. So, Tara, part of it is about side effect management. You're taking medicine that definitely have side effects, and I would imagine constipation would be an issue with that. I would understand your desire to want to reduce it. It makes total sense to me. But if you don't address the original stricture, then you're still gonna have pudendal neuralgia. And then the other thing that would be an interesting experiment would be palmitoethanolamide, because if you go to PubMed and you start researching and looking at all the research studies with PEA for pain, the general consensus is that it's the best for neuropathic pain. And so for people with central sensitization and or pudendal neuralgia, it would be potentially an interesting experiment. But you can go over to pubmed.gov and you can go to our store and you can copy and paste the actual chemical name, palmitoethanolamide, and go over to PubMed and type it in there, and you can read all the research studies. So it was found helpful for sciatica, which is a nerve issue, which is basically very similar to pudendal neuralgia. And so there's a chance that it actually could be helpful. Felice says, can you send it to Turkey? I need it. We had an issue with Turkey. Felice, what I would do, I think that might have been you who asked it before. Let me look. Did I turn Turkey on in our store? I know we had it turned off, and then I thought we turned it on like 3 weeks ago. Hold on a sec. Let me just look here real quick. Shipping supplements is tricky. Every country has its own rules. Most of the European Union does not accept supplements from the United States. And now we can't send to the United Kingdom because with Brexit, the United Kingdom is now asking us to collect VAT, and we don't know how to do that with our software. It requires software that interacts directly with servers in England to assess VAT. So my suggestion would be, if you've got a friend or a relative living in the United States, that you ship it to them, and then they can send it to you as a gift. But I can't send it to you as a gift. I have to do it legally the right way. So, Feliz, we have Turkey turned off in our store, and that means that we had issue with delivery. And so what happens then is it usually gets sent back to us by your custom service. So what I would do is I would look for PEA, palmitoethanolamide, and let me just type it in Facebook here and copy and paste it. That's close. I'll copy and paste that and take it to a drugstore in Turkey, okay, and see if they can get that for you. The version that was used in the Italian research studies is called P. P. I think that's your best bet right now. Thank you, AVC. Thank you so much. You're sweet. What do I think about lysine clonixinate for the pain? I don't know anything about it. Let me look it up. What the hell is that? I feel like at the end of these meetings, We need to have like a group curse session just to get it all out. Right? Because it's actually recommended in the pelvic pain group. Lysine plunixinate is an NSAID derived from nicotinic acid that is proven to be effective for various pain syndromes such as renal colic or muscular pain. I wonder what the brand name is. Hold on. Maybe, I mean, I have to say the scientific name is not resonating with me at all. Plunixin. Clonixin. Well, it's an NSAID used in the treatment of chronic arthritis and certain soft tissue disorders associated with pain and inflammation. It looks like it's made in Portugal. No, I'm not sure. I mean, it might be interesting to try, especially if you've got muscle-driven pain. Why not? Holly says, "You're amazing, Jill. Thanks for being so generous." Oh, you guys are sweet. Thank you, Annie. Thank you. All right, guys. Well, listen, if you like what we do, if you like these meetings, please come on over to our website and at least, for goodness sake, sign up to receive our free newsletter. And when you sign up to receive our free newsletter, you will get, there's a pop-up window that will come. You'll get our 40-page flare management guide, which is the next project I've got to do. I've got to update that. Or better yet, become a member so you can get our magazine. Because I'm telling you, my latest magazine is, I think, the best one we've ever done in 17 years. Multiple pain conditions explained, chronic overlapping pain conditions. It's so exciting and it's so hopeful. Now we understand it. Now we get it. Okay. All right, my friends. I will see you later. Be well. And David, I see an email from you real quick. Yeah, David, that would be fine. If you could do that, that would be great. David was just going to make a donation of $50, and that would cover the book and the shipping. All right, my friends. Thank you for your emails, getting lots of emails. Okay, if you would like one of the free books, Breaking Through Chronic Pelvic Pain, you got to email me, icnetwork@mac.com. All right, guys, I'll see you later. Be well. All right, Facebook is done. All right, YouTube. All right, you guys. I got to split off and do YouTube on another day so that we have better video quality. All right, you guys, I'll see you later.